You have extended the screen, right?
Hmm.
Yes, sir. No option is coming for this one color. Just a minute. I can try once if possible is there. हाँ, this night mode is
अभी ठीक है?
हाँ this one better ना sir. Okay. It I have to save ना. No save. Duplicate करूँ?
नहीं, जो पहले आ रहा था ठीक आ रहा था ना.
जी.
Duplicate will be
Same screen will be visible.
no. Here I think no, आप वही करिए ना. Extend will be better ना. The slides will be coming, right?
Yes. Mic is on. Microphone is on. Okay.
Okay. Excuse me. It's not showing.
Sir, you have kept it on the extended mode, no? So this is primary screen and that is secondary. So I am asking to keep on the this
कर
one.
दो फिर.
Windows P. Keep on duplicate. Okay.
कंट्रोल क्या बोला आपने?
Windows P. This one. Now the visibility is clear, no? Color.
Okay.
Sir, yes, sir. Three handle mic. Mic is there.
Okay. मेरा.
यूल की भी और नहीं है ऑलरेडी या कैसे?
हाँ नहीं ठीक है.
अब मैं एक पीपीटी भेजता हूँ, वो मेरा सेशन है, उसको बीम करना पड़ेगा. मैं टीम्स में भेजता हूँ. नेट चालू है?
हाँ. एक मिनट ना. ये मैंने ना.
बेटा ऊपर टेक ओवर. ठीक है, मैं टीम्स में भेजता हूँ. थोड़ा 10 मिनट मेरा बाद में ही है सेशन.
तो ओपन कर लेना. खुला हुआ है.
टीम्स ओपन है?
देखिए मेल कर दो. मेल ओपन है. टीम भी ओपन है.
discuss the potential of 5G, robotics, IoT drones, and leveraging the emerging technologies for public healthcare services. Now, I request Ms. Anna Roy, ma'am, to come and give the inaugural remarks and open the session.
Good morning. My name is Anna Roy. I'm Senior Advisor in Niti Aayog, heading the vertical on data and emerging technology. Today's workshop is essentially to interact with the stakeholders so as to lay down the way forward on how we can mainstream new technology in promoting and making a more robust public health infrastructure in the country. So with that goal, we have a very good group of people. We have policymakers, we have regulators, we have startups, we have big industry, and we have a very good representation of Niti leadership. To begin with, I would like to introduce some of the key people who will be participating today. We have Dr. Vinod Paul, who is member health and leading everything relating to the health sector in the country. Thank you, sir, for taking out time and coming all the way to Mumbai. We have we will shortly be joined by Mr. Rajiv Bansal, Secretary Civil Aviation. From Department of Technology, we have Mr. Sanjeev Agarwal, who is a member in 5G Committee of Department of Technology. From the other stakeholders, we have Mr. Sharat Sharma, who will be representing iSpirit and handling the technical aspect of it. For the drone session, we have a very big team from World Economic Forum. Vignesh is there. Of course, Purushottam Kaushik, sorry, we all call him Puru, so the full name was I was just missing it. So Purushottam Kaushik is overall WAF, drone plus other health sector things, but the drone thing in WAF is being led by Vignesh. For the post-lunch session, we will be joined by several representatives from the industry who will be presenting some of the technologies. The most important part for today's deliberation is the representation from the state government, because at the end of the day, the central government can come out with policies, regulatory measures, but it is the states which is the hub where we have to kind of, make sure that these technologies are embedded. And I welcome all these state representatives who have taken time to travel all the way to Mumbai and join in today's deliberations. The purpose really is to make it an interactive session. We don't want to have long speeches, one-sided speeches, and we have kept time for open houses, so please feel free to share your views. That is the ultimate goal of today's workshop. At the close of the day, Dr. Paul will be kind of summing up the deliberations and giving a way forward where it would comprise of various policy interventions, regulatory interventions, as well as other institutional interventions which are required for mainstreaming emerging technologies to improve our public healthcare system. So with that, I would request Dr. Paul to kindly deliver the keynote for today's session.
Namaskar. Good morning. Very warm welcome on behalf of Niti Aayog. Respected Shri Sanjeev Agarwal, sir. Distinguished colleagues from the state governments, colleagues from the Indian Council of Medical Research, other arms of the of the Government of India. Above all, our partners, ID Spirit, World Economic Forum, GEO, and really above all, the community of startups, innovators that has joined today in this hall this morning. Truly grateful to you for coming together. As my colleague, Ms. Anna Roy ji has explained, the purpose is to have a churning around priority technologies and to find pathways to translate the potential into sustained action, sustained reality. Having technology alone is multi-sectoral to begin with, but to take technology and translate that into service delivery, change in life of individuals, and so on, requires many partners along this chain. What we are trying to hope and do this today is to look at that pathway very systematically and create a pipeline which is seamless, one team pipeline of all the players, innovator, private sector, government, community, regulatory system, different arms of the government, state governments, other players. That's what we're trying to. It's a thinking meeting. It's a melting pot today. And we've taken two broad areas, but by extension, the same paradigm in terms of finding such pathways applies to other technologies as well. And that's why a certain, this group has been convened. First and foremost, we would like to know, as we move, particularly for drones, particularly for 5G, but by extension, other technologies such as point-of-care diagnostics and so on. What is it that's potential, and IT use, and AI use, and so on. कोई लिमिट नहीं है, दो खास तरह से फोकस कर रहे हैं बिकॉज उसमें हमें प्रैक्टिकल एक्शन, थीमेटिक एक्शन एरियाज हमने आइडेंटिफाई करने हैं. बट बाय एक्सटेंशन we believe the process is the same. What is it that is there on the horizon? Potentially. And India can take lead. India must take lead in these areas. We must be the nation to look up to for emergent technologies for healthcare. It is our destiny. It is our destiny. And we should lead it. We already lead in many, many ways. And you are aware of that. But I think to really make technology use as a way of life is the path that we must fully facilitate and fully deliver on that. So what is there on the horizon? Possibilities क्या हैं? हम सबसे पहले उनमें भी लगें जो कि इस पॉइंट पे हैं rather than यहाँ पे हैं या यहाँ पे हैं. हमें ये भी सोचना, हमें आपसे ये सुनना है. Second issue is, in order for us to demonstrate the technology, the first step is demonstration. How do we create? How do we adapt? How do we refine? How do we work together to make it the most relevant? And then, how do we test it in real life? In a primary health center, in a remote island, in a busy hospital, Safdarjung Hospital, AIMS, other hospitals next door, in mountainous locations, in home settings. A lot of healthcare is moving toward home care, care of the elderly, care of many diseases, enabled by telemedicine, for example, particularly through that. But even otherwise, care is moving to homes. How do we adapt that path? For one technology, there will be many, many pathways and many, many points of delivery. How do we do that? And third is, How will that become a way of life as part and parcel of the program? Potentially. That's in the clinical trial, we call it effectiveness level of studies or implementation, science implementation research. And then above all, how do we ensure that that technology is then finally embraced by the public health system and the private health system, as the case may be, and becomes part of life? For that, I just want to mention, and starting from that end, that the Ministry of Health and Family Welfare has set up what they call a single window vertical for startups on hand-holding, partnership, incubation, and absorption of these technologies. So there is an effort out there to which we will ultimately plug a ready technology कि आप ये शुरू कर दीजिए. अब हम ये मान लीजिए कि we have a 5G enabled technology which can look at the ear, which can look at, let's say, can do refraction, make it a way of life in all our 140,000 health and wellness centers. Now that is the final outcome, the day we will really celebrate. Endpoint. And then we move on to something else. So these are the multiple steps, and perhaps there are other sub-steps within that. But one of the core issue and a problem has been that the innovators, typically engineers, typically the people who have grasp of these technologies, visualize a use case, they build a technology around it, and they make early proof of concept. And by this time, already months have been spent, your own money has been spent, and so on. And one gets an impression that I have done it. And you'll come and tell, हमने तो बना दिया, हमने तो लग गया, अब क्या करें? उसमें दो problems हैं. One, that other path has to be understood, but the immediate one is more important. We need to, invention alone, even with proof of concept, is not sufficient for uptake in the health system, particularly for health system. I don't know about other sectors. Unless it has been embraced, used, experienced by healthcare teams. वो तो था ही नहीं, आप तो अपने पास बैठ के बना रहे थे. हमें co-create करना है. After a point, in fact from the very beginning, technology use cases, technology products, shall we say, meant for health must be co-created with the health sector. एक बड़ी advice है startups के लिए. बहुत late आप आते हो. आप बना के बैठे हैं, लेकिन टेस्ट अगर एक न्यूबॉर्न बेबी पे करना है तो डॉक्टर या नर्स तो आपके साथ शुरू से होनी चाहिए. उसको भी क्रेडिट मिलना चाहिए. आप तो इन्वेंटर बन गए, आप तो स्टार्टअप, उसको क्या क्रेडिट? फिर मैं सुनता हूँ कि आप करिए ना, हमने बना दिया है, आपका काम है. ऐसे कौन करेगा? अपनी ज़िंदगी के 6 महीने वो क्यों लगाएगा? ये सोच के चलो. ये स्टार्टअप्स के लिए एडवाइस दे रहा हूँ. शुरू से को क्रिएट करिए और डीप करिए. टीम में 2 स्ट्रैंड होने चाहिए, 2 पिलर हैं टीम के, तब ये घर बनेगा. Inventor, technology, and a person who is belonging to the health sector. It may be an ASHA worker, it may be a doctor, it may be a super specialist, it may be a surgeon, and so on. तो ये थोड़ा ख्याल रखना है. एक तो ये part है. Now, as I said, one of the major issues that I have been personally concerned, and my team has been personally concerned, is that we have a robust technology, but we don't find pathways to test them in real life situation. In implementation science and implementation research, there is a notion of valleys of death. The notion is the following, that there are so many molecules potentially in laboratories in the world, including our own, which are potential cures, let's say, for cancer, for hyperlipidemia or something. Potentially, because in the pathway you can see this is what it does. But that itself doesn't become a medicine. For that molecule to become a formulation, it has to go to a GMP level of production. It has to be tested in animals. It has to be then tested in humans. Phase 1, phase 2, phase 3. And then somebody has to be ready to manufacture this on scale. So we need an industry partner. And then there's a regulatory issues. This is a long path. So what happens is that you have the molecule, but it doesn't reach the patient or my father at home. And this whole gap is the valley of death because of missed opportunity. Ultimately, you will realize there are multiple valleys because one would be making a connect with the clinician, to which I referred. This clinician then testing, finding budget to get the testing done and ethics clearance. After that industry, after that regulation, हमें इसको ब्रिज करना है. तो एक पर्टिकुलर वैली जो हम ब्रिज करना चाह रहे हैं कि आपके पास टेक्नोलॉजी है. आपने कहा कि 5G बेस्ड वेयरेबल बेल्ट है मेरे पास जो फीटस की मॉनिटरिंग कर सकती है घर में. And based on that, I can get this young mother, 21-year-old, in case there is a fetal stress, within an hour, within 45 minutes for a cesarean delivery, done within the next 3 hours total. It's possible. Technically, it's possible, in one of my wish list idea, right? Now, you want to test it. You have the belt, you have the technology, you have the 5G in this room. How do I test it? Where do I go? That is one area that we want to bridge. We are very clear. So we will work with the Ministry of Health, we'll work with the Indian Council of Medical Research, and we'll create these field sites or hospital sites or shall we say population sites to test these technologies. आपको हमें approach करना है systematically that you have something, can we test it in a setting of, let's say, primary care or setting of a busy district hospital, and we will find a way that we lead you to that. I'll give an analogy how it works. For corona vaccines, already the DBT, Department of Biotechnology, had created vaccine trial sites. This was done 2-3 years ago. It was done after rotavirus vaccine was created in India. After that, multiple vaccine testing sites were created. Now, what did it mean? That we knew in this population, so many young children, so many adults, so many men, women, they are there. There is a hub where there is a statistician, there are researchers attached to a center, maybe a medical college, let's say. And this population estimates are known. Fundamental issues are known. Vaccine storage capacities, like cold chain, etc., are made available somewhere in that population. And then when the vaccines, we didn't know what we will use it for. We would have thought we'll use it for HPV. But then when the time came, these were used for COVID-19 vaccines. And let me be specific. For DNA vaccine on 28,000 individuals, practically all the trials at the population level, 28,000 ka trial kiya unhone during Corona using these sites. So they came, they plugged, they played. Covaxin ke liye 25,000. Much of the trials were in these areas, maybe some additional ones in the private sector or whatever. We want to create an ecosystem like that, that you bring technology and then say, I need to test IoT-driven ICU fire preventive algorithms in a busy hospital. And we'll say, okay, here is KGMU Lucknow, very busy hospital, resource poor, but extremely busy. We have an arrangement, we connect you there and you start working. You tell me you have this wearable belt for fetal monitoring. We say, okay, we have 5 sites where all this can be done. Please go there and we'll facilitate that through government funding. That's the idea with which we got the partners here, and that is the system that we hope to create. So that you can go and test, and there's a facilitation effort. There are partners you'll find who will make this access possible. ये नहीं कि आपने उसको सिफारिश करनी है और फिर उसको कराना है, उसको ढूंढना है. ये हम कोशिश करेंगे कि ये सिस्टम हम बनाएं. What we want to know from you is what would be patients जब आप ये लेके आइए. 5G enabled ambulance where live back and forth advice can be given. Treatment started in the ambulance. Suppose we have to test it in a state, remote Bulandshahr district, where certain real life situation is to be simulated. We'll say we can do it for you. Bring this technology, चलो चल करके दिखाते हैं. हर एक चीज़ वो मैदानता के आसपास नहीं करनी है आपको. वो तो जियो ने डेमोस्ट्रेट कर दिया. रियल लाइफ में, डिफिकल्ट रीजन में, आप ड्रोन करना चाहते हो, तो हम कहेंगे लाहौल स्पीति में आपको हम चांस देते हैं कि लाहौल स्पीति से आप उठाइए और उसको आप मनाली लेके आ जाइए, करके आते हैं. तो ऐसा इकोसिस्टम करेंगे, बिकॉज व्हेन द स्टेट गवर्नमेंट्स बिकम पार्टनर्स, union government becomes partner, and institutions such as ICMR, whose job is to create an innovation research and a research system, we will rise to the occasion. And research, by the way, is not only laboratory science. Research is also how these things work in real settings. We call it implementation research, we call it operations research, community-based research. It's well known, and the methods are also well known. Also, what are the ethics aspects to be taken care of? For some of these, typically, you will need an ethics system where human lives are involved. तो उसका क्या करना, आपको मदद मिलेगी उसमें कि हम एथिक्स कमेटी बना लें, अगर ज़रूरत होगी. हर एक में नहीं ज़रूरत, आप ड्रोन से यहाँ से उठा के वहाँ, उसमें नहीं चाहिए. बट यू हैव अ डिवाइस, फॉर एग्जाम्पल, एंड मान लीजिए कि वी आर डूइंग अ रिमोट optometry of school children. Right? From this end, I'm looking at the eyes of a child in Meerut district and prescribing glasses from here, let's say. Because there could be error and there could be a wrong decision, so you need an ethics system to do it. So we'll create that system, whether it has to be technology-wise or site-wise, that can all be handled. So there are those aspects, and also facilitate you with the regulatory system, and ultimately link it to the Ministry of Health's idea of absorbing these technologies into the program in a systematic way. I believe there are technologies for TB detection, AI-based, but they have not yet become part of our program. But they should. If we know they are our own, they have stood the test of time, why are we delaying it? So those pathways have to be created. Everything is in place somewhere or the other, but the connections are not there. And this meeting is about creating those connections and those pathways. Ultimately, the word is we like to create a system where you come, you plug, and you can play. That's our hope. I just, in the end, want to emphasize the fact that 2 parts. One, there will be and should be focus on both aspects. One, disruptive technology, which can be useful also in Sweden, or in Canada, or in Australia, or in Argentina. हमें वो भी करना है, तभी लीडरशिप दिखेगी, वो भी सोचिए. Secondly, but more important from India's point of view, technologies which change the lives of the poor, those in rural areas, and which generally would also mean technology which help the primary health care. So हम दोनों ही कॉल आपको दे रहे हैं. आप कटिंग एज करना ही करना है, तभी वहाँ पे हमारा देश का झंडा जाएगा. होना ही चाहिए. Our technology should be used in Germany, right? At the same time, we urge you to also think about ideas where technologies can be used in the primary healthcare setting. We had an opportunity to look at a suite created by Geo, where very comprehensive evaluation of the patient can be done at Health and Wellness Center with a lot of decision making through telemedicine and so on. That makes the life easy. Sure, we should do it. There are challenges of screening for cancer. There are challenges for diagnostics all the time. So all that is very important. So think about primary healthcare on the one hand, and think about the highest end solution for the developed nation as well, because that we will also be needing in our hospitals, in our field settings, and so on. Having said that, when we had an opportunity to visit 5G exhibition, sir, that you had hosted, and you kindly invited us, some of the ideas that came up, I'm just listing, but we need a wish list of such ideas, a big one, and then we'll. And DOT has thought about even more ideas than what I'm going to share. One is teleconsultation by primary care providers enabled by 5G-powered smart diagnostic devices. I repeat, teleconsultation, primary care hubs enabled by 5G using smart diagnostic hubs. Now, where will this be useful? Health and Wellness Center, mobile medical units, home-based care of the elderly, schools, health camps, disaster situations. छोटा example है, just a trigger. Second, advanced 5G enabled ambulance and emergency care. I think we already have the technology. It's a matter of starting to use, look at how it can be done, and create demonstration sites. Prevent fires in hospitals with Internet of Things. This is Anna's idea. We get a lot of fires in summer season in hospitals. कुछ report होती हैं, छोटी मोटी report नहीं होती. ICUs are a place where there is a lot of load on there are machines and there are a lot of electricity load. Can we detect, can we anticipate, and can we prevent fires by putting IoT sensors so that short circuit, increased temperature can be picked up, or at the least, earliest detection is possible. सोचे इसके बारे में. Prescribing spectacles for children with defective vision by teleoptometry. Today, for glasses, you need a very trained person, not a doctor, but an optometrist. And our country has shortage of optometrists for long. 8 to 10% children need glasses. Almost everybody above a certain age needs glass. Unmet need is huge. तो दूर से कर सकते हैं क्या? If we can do remote ultrasound and technology exists today, can't we do optometry that I can prescribe glasses? Is that possible? This is one of our wish lists. Wearable sensor for home-based monitoring of fetal health among women with high-risk pregnancy. I give you an example. And I have a request from IIT Mandi that they have this interest in this. Teleimaging, you'll be hearing a lot about it. Of course, training of doctors and others using VR, AR technologies, drones for healthcare, and so on and so forth. But the commitment of NITI, or NITI's agreed pathway is that we will create a collaboration. That's what we are trying to do. Make connections and pick up on your ideas, and to create an ecosystem where we generate technologies, we refine technologies, we adapt technologies for our own nation and our communities. We provide you a testing ground where this can be done, and that's a big one from our point of view, and doable, and much awaited, and then ultimately to absorb the technologies into the healthcare system through a certain transparent, structured approach. I pause here and be happy to, then we'll come back in the end to learn and to synthesize a way forward with your help. Thank you very much. Jai Hind.
Thank you so much, sir, for setting the context and for enlightening us about the paradigm of technology and healthcare in Indian context. Now, I would like to invite World Economic Forum India head, Mr. Purushottam Kaushik, to come and tell us about the WF initiatives in healthcare.
Very good morning. I represent World Economic Forum in India. The center which we have in Mumbai is called Center for Fourth Industrial Revolution, mainly focusing on how 4IR technologies can really be absorbed across various sectors. And the center today, I think this month, should be completing 4 years now, since 2018 in January, when Prime Minister had gone to Davos. Subsequently, when came back in October 18, NITI is our host, so this is another good place to celebrate that as well. In the last 4 years, we have really worked across as a more like a multi-stakeholder institution, and today's room is a full representation, as Anna described. Like we have obviously government institutions, we have industries, we have startups, we have academia and research institutions as well. So this is a true representation of what multi-stakeholder, and as Dr. Paul said, house cannot be made on one pillar. It has to be made with the pillars all added up, and that's what we intend to work on. The second big focus has been on the technologies. Now, when we talk of 4IR technologies, for sure, data being the foundation base, we also are looking at how AI, we spoke about it, like how AI could be used for cancer screening, or possibly now the new technologies like metaverse and blockchain, they're going to be shaping up the world. So how 4IR will get adopted in many of these sectors. We have worked across sectors, agriculture, health, urban transformation, education, and now we are looking at circular economy. But let me talk about the health initiative, which we started about like 2020, somewhere in later part of 2020, when we launched this initiative called First Health, long name. First Health would mean Fourth Industrial Revolution for Sustainable Transformation of Health. And we prepared the whole strategy along with all the industry stakeholders, and we did a lot of consultations. We shared it with the Ministry of Health and also with NITI and Ministry of Electronics and IT, because technology being the pillar. We looked at now subsequently going deeper into the same and have launched First Cancer as a part of First Health. Cancer is a big initiative. We have Mr. Ram Kumar from Meghalaya. We announced recently a partnership where Meghalaya is going to be doing a big pilot. It's a population scale pilot, or rather I would say implementation of and Meghalaya will become the first state of using 4IR technologies for cancer care, where there will be 3 big interventions. First one is going to be screening, which Dr. Paul spoke about. Now there is a 700,000 population approximately in the East Khasi Hill district. It's one of the highest cancer incidence rates which happen in Meghalaya, as per the recent reports also, where CM is really worried about. And technologies can be the biggest bridge. So how can we use AI and using maybe either thermal imaging or using ultrasound, and then apply AI on top of it for early cancer detection? Which is just sharing the data, and possibly it should be correct, is around average delay in cancer detection is around 8 months, which would mean much higher casualties and much higher cost of treatment. So that, and plus it's not also a notified disease. So practically we are struggling with the whole challenge in which Meghalaya is going to see. The second intervention is going to be on capacity building, where we have all the primary healthcare workers and also the doctors and hospitals. How do we bridge capacity within the non-oncologist sector? And then we leverage technologies like AR, VR to kind of build the capacity there. And third one, which is one big one, which I was speaking to Harpreet from ICMR as well, that there's a big gap on the data. Now, currently, we are, as an additionally, an initiative where Meghalaya is working with Ministry of Health, and then there is a public health monitoring platform. We are looking at oncology data model to kind of curate the whole data set. So the reason why I gave you all these details is that how possibly 4IR technologies are going to be shaping up future for such an important sector on health. We went deeper into cancer. My colleague Vignesh will talk about how drones are becoming like relevant for delivery of vaccines. Now the pilot's happening, but then it will be used for many other applications as well. Now the reason why World Economic Forum, and I think there was one interesting question came in, what do you actually do? So mainly 3 big focus areas. One is that government, industries, and startups need to find those working relationships. It's called public-private partnership, which would mean government can be a big enabler, not necessarily only a procurer. And startups can really focus on those use cases which can be niche, which possibly needs much more agility and much more adaptation to the local needs, while industries can always be more like a larger product and infrastructure provider. So that's something which we're trying to make it work. And while many of these technologies are really in a different time maturity cycle, metaverse, we can keep talking about it for a few years, but then it will slowly see adaptation in various sides. Blockchain is already a part of many of life. On the maturity of cycle, it needs a detailed level of understanding. Now, similarly, the ecosystems are getting disrupted. We spoke briefly about it, that the existing ecosystems will completely get disrupted because of the technologies becoming a part of it. And that absorption needs to be much softer and much acceptable and it can't be forced. And then the other issues are going to be more like standards, interoperability, biases in the technologies, inclusivity requirements, and finally investments as well. So how these things will shape up and become a part of many of our initiatives. And for sure, today's discussion is going to be on health and focusing on different technologies getting part of health curative systems, preventive systems, or governance. And we will see how we can really bring all the stakeholders together. So today is an open platform. Welcome you all once again. And let's keep it interactive and keep it going. Thank you, everyone.
Thank you, sir. So in today's workshop, our focus will be on 2 main emerging technologies. One would be scaling up the drones ecosystem for healthcare, and the second segment would be on leveraging 5G technology for public healthcare services. I would now like to call upon Vignesh from World Economic Forum to start the segment on drones.
Thank you. And thank you to all our guests and dignitaries who've flown from different parts of India to be present here today. Special thanks to our partners Niti Aayog who've helped us come to this point in several ways. We'd like to start with how the drone agenda is, and basically today's discussion, actually the outcomes that we envision are more than what the programs have accomplished. We're also looking to make it as issue centric as possible. To see what can be done better, and in alignment with what Dr. Paul said, how can we ensure that we are able to create an enabling environment for more successful demonstrations and then full-scale trials. So our discussion today will be along these lines. We'll briefly touch upon the use cases of drones, deep dive into one of the case studies, which is medicine from the sky, identify what the issues at hand are and what some of our learnings were during these coordinated programs, and also outline what questions we would like to have answered today. We do have some great speakers and representatives from state governments who've come from very far away, as well as startups who've been demonstrating the capability time and again for years now. So this is essentially a spectrum of use cases. So come 2020, when the lockdown was imposed, we did see a significant uptake of drone technology, and a pretty interesting landmark is that when lockdown was imposed in March 2020, we were under the UAS rules 2021, which came sometime in April, and before that the civil aviation requirements. So we were sort of aligning ourselves with the policy of the day. But in August of the same year, 2020, when our drone rules were liberalized, the drone ecosystem saw very big uptake. We did see, for example, in Bangalore, streets getting sanitized using drones, by spraying of drones. Several times we've seen thermal sensors being mounted on drones to identify differentials in temperature in crowds. And not very far away from where we are, Mumbai police also use drones to manage crowds while imposing Section 144. And one of the more flagship programs that we did was called Medicine from the Sky, which many of you are aware about, which helped us, bridge gaps, literally actually, bridge this whole valley of death situation and access areas that weren't particularly accessible. So when we initially began this program, the scope included blood, vaccines, samples, and even organs. While of course we haven't reached the phase of organs as yet, and even blood logistics is something that we are working on the sidelines. What we have been able to work on with the help of our partners present here is the delivery of diagnostic samples and vaccines, which started in September. So, as mentioned earlier, the liberalized drone regime has been quite a game changer. Specifically for the state governments present here today, the Drone Shakti scheme that the government of the day announced at the Union Budget 2022 did put in a lot of emphasis on the need for procurement of services. Now, there is a little bit of ambiguity around drones and the hardware at large. And I think the procurement of services will make it asset light. And that's what initiatives hosted by Niti Aayog, which will be discussed later in the day, will touch upon. After the opening up of our opening up of our skies largely, the delivery of vaccines, medicines, and samples kicked off in the state of Telangana, which is of course now graduated to Arunachal Pradesh through this coordinated Medicine from the Sky program. But that said, we're given to understand that at least 14 states have worked on this initiative or trialed it in many ways. So, over and above just the accomplishments, we all have seen a lot of this in social media and in the news about what drones are capable of. We also want to know, what are some of the misses? What is it that, we can focus upon and what can be improvised as we go forward? So we also have colleagues from ICMR present here today who have also conducted similar programs. And we believe that this whole one umbrella approach will, help us work together and nationalize this program and ensure that, it is coordinated for a pan-India coverage in terms of either a special purpose vehicle or porting of the experts present here into a working group at large. Through the MFTS program, we have drone-enabled around 29 PHCs and CHCs until now. We've touched upon 3 districts. And as per our sort of estimates, we are hopeful to hit about 60 by end of next year. The discussion is open as to whether that's a good number or a bad number, but ideally that's where we want to be. In terms of areas to address, we had 4 specific buckets that we touched upon: perception, infra, operations, and regulatory. These are things that are encountered time and again. Every geography, in the country, every region in India has its own share of issues. We are encountered with different problem statements, due to terrain, due to regulations, due to airspace. So these are things that we would definitely like to touch upon. So I'll give, just in the interest of time, share one example from each. Now, what if a critical PHC is located in a red zone? And how does one approach such a situation? Whom do we coordinate with? Who are the people to talk to? So in parallel with drone deliveries, it's not a one-man solution where a drone flies from point A to B. There are supporting paraphernalia that we need to get right. So if we are to do that, how do we make how can we create a parallel regulatory regime along with the program of the day that's happening? So that can only happen if we maintain this multi-stakeholder and this coordinated approach, bring everyone to the table. We also invite our colleagues from the DGC and the QCI to come forward as observers who are present here today, to come as observers to see the kind of work that's happening. The infrastructure is, what is the anatomy of a drone hub? How do we classify a PHC or a CHC as drone enabled? Having leveled land, power stations, the general infra of the place. 3 is the perception. So now I think the greatest, one of the biggest things that usually drives such an initiative home is including the local populations, which is something that we've done in the Northeast. The Northeast, of course, has taken pole position in this sector. But that said, if the locals are engaged, if they are on the right side of the technology and made aware of what can happen, I think the implementation, the adoption cycles can be scaled way faster than they actually are. And one point, of course, may be a little unpopular, but I'll just say it nonetheless. I do feel that some of the PR cycles that go in parallel with drones tends to set a larger expectation. So how can we manage that? How can we ensure that we make sure that the expectations are in sync with what really happens? So just because a drone sprays pesticides does not necessarily mean we will have a bumper crop in the next cycle. So those things definitely have to be addressed in a big way. And then finally, operationally, because if the biggest beneficiaries of this technology is going to be the healthcare workers or the ASHA workers, they need to be trained on the technology on ground. And we have Apollo Hospitals present here amongst us who's been running some of these training programs for health workers on ground. And if we can, draw that down to a science, build a curriculum out of it, and set up this entire process like a clockwork, then it is only a question of implementation and scale. So a snapshot of what the learnings are: validation exercises is the need of the hour. There is still a little bit of ambiguity around the unit economics. We recently published a Medicine from the Sky report highlighting our Telangana program. We put out the parameters of the economic parameters there, but we did not publish a number deliberately because we felt that we needed more experience and more sorties to be able to arrive at that sweet spot. And finally, streamlines procurement. I think one of our experiences has been that we do a lot of field trials and demonstrations. The startups who are pretty hard pressed on various levels tend to do all of this quite actively. But when it comes to actual procurement, there tends to be a bit of cold feet. And the reason for that is largely because of the ambiguity around the technology, which we would like a forum like this to clarify. And as mentioned earlier, of course, the regulatory regime to support the nature of the projects that we do, flying beyond the visual line of sight, flying in critical and sensitive areas. We initially defined these stages of graduation, wherein we looked at a 45-day proof of concept, in short, then a 6-month full service demo, which is happening in some of the states, as we speak, and finally scaled up commercial deliveries. Now, this can also be looked at as a roadmap because some states are actually a little early on the adoption cycle, while some states are pretty much advanced. So we expect that today's discussion will help all states come to the same page to a fair extent, take similar decisions, and if some states are embarking on a model of procurement or implementation, we would like those ideas to be shared over here, just so we are all in sync. And I'll just put this out there. This is what we would like to discuss today. Some of the many things, it's not restricted to this, but these are guidelines as to what we want today. We do have an expert group. Everyone here comes with a solid amount of experience in health, in drones and technology. So can we come out with a common statement of purpose, that we can work on together, maybe a sort of special purpose vehicle that we can create out of those assembled over here, led by the government, where we can scale this nationally and also in a very graduated manner. Understand the best, so at least identify a sweet spot for procurement, at least procurement of drones as a service. And finally, address the supply side constraints. I mean, this is a discussion that has done the rounds in drone circles for a long time, as in, are there supply side constraints when it comes to components? If yes, is that translating to a supply side constraint at large? So how do we address that? Is it, first of all, is that hypothesis right or wrong? That's something we need to do. And at the end of it, managing of our airspace. I think 5 years from now, we will have a more crowded airspace. And for that to happen, we need to streamline how we manage it. Right now, of course, 90% of India is in the green zone. But we need to definitely take a closer look to see how we stand and to ensure that there is complete deconfliction from manned aviation and even unmanned at large. And finally, are there any platforms, for example, maybe the G20 or any of the other platforms which can be used for this program to springboard into actionable insights? So largely, we would like everyone here to actually speak up, make it free-flowing and contribute and share your views as to how can today's event translate to actual action on ground. So again, for the sake of repeating myself, I don't want to repeat myself, but I believe that we should focus on issues and solutions more than actually about what we've done. We definitely want a roundup, but ideally we will keep today's session as issue-focused as possible. So I'll leave you with a snapshot of all the stakeholders who are involved in this. Once again, thank you, and we look forward to a good discussion today.
Good morning. So emerging technology, which has a lot of impact for public services, public healthcare, specifically today's topic, would need a market maker, and government presently poised is the biggest market maker, but it can perform this role only if we have streamlined procurement regime, We have seen how a streamlined procurement regime transformed the infrastructure sector in the country. Today we are seeing highways, airports, ports being built at such a great pace which we could not achieve for several decades in the past. So recognizing the importance of procurement, the budget this year announced that drones as a service would be the focus, and Niti Aayog was made in charge for coming out with procurement guidelines for drones as a service. Now, why drones as a service? Why not a product? I will be touching briefly, but I will not really go through the presentation as it is. There are, I think, more than 20 slides. I don't want to waste everybody's time, but I'll just give the gist of it. Any emerging technology, you do not want to be tied to technology because it is evolving. So procuring a service is always better than getting tied to a technology. That's why the focus on procurement of drones as a service. So when we focus on the ecosystem, we see a whole, in the drones ecosystem, there are several players. So any regime, any institutional framework for procurement need to address the concerns, issues, and, vision and mission for all these stakeholders. And we all know how the recent years saw a huge liberalization of the regime. So the idea is how can we leverage this policy regime to scale up the drone ecosystem. In the recent regime, we not only saw regulation on the aspect of operation of drones, but also manufacturing, promoting services, as well as skilling. I already touched upon this, why drone as a service. And this also really essentially addresses that. We will be sharing this presentation, so I will not go through verbatim with it. Now, when we talk about service being a better way of procurement than product, it almost is like besides not getting remaining technology agnostic, you also have a life cycle kind of a approach where you don't have to focus on the maintenance and other aspects that can be really outsourced, and governments are not really known for doing that. And we benefit from the changes in the ecosystem, in the technology, and also benefit from the better operation and operation practices of the private sector. These are some of the areas as work began in Niti Aayog on promoting drone as we have focused on these sectors. We also went through some of the past, instances where it was used by various institutes. We studied their mechanisms, their processes, and we also identified who are on the supply side, who are on the demand side. Having done that, then we went on to identify the challenges which today we face. Basically, as Vignesh also mentioned, there is a gap in procedure for innovation and technology procurement. These are not standardized. There is a lot of uncertainty. There is a lot of problems, and today hopefully we'll learn more about it from the people present here. So we have come a long way, but still it is work in progress, where we are working on developing model agreements, procurement documents, which will be approved through proper government processes based on interministerial, intersectoral stakeholder consultation, which gives the necessary backing for any public authority to procure without going through a very, very detailed process. So this will include a model RFP, a two-stage perhaps qualification process, a contract, a model contract, outcome-oriented framework, and something where, we will not be focusing on the input, but detailing the outcomes and setting a common field for everybody by specifying those conditions which are important for the government and for the sector, because as everybody knows, drones have a very, very specific, safety and other aspect to be considered. So in the standard procurement documents, besides the RFP, we will have the standardized documents, on the SOPs, on leveraging drone as a service. What will be the exact, scope of a project? Will it be just capturing the data or also processing the data? What is the best model? So we will be exploring various models and coming out with documents on that. And as I said earlier, it will be an outcome-oriented approach that we will be following. The underlying philosophy of this documentation is basically, having a balanced risk and reward amongst the authority, that is the one who is procuring the service, and the service provider, allocating the risk to the party best suited to address it. That's the basic philosophy. Secondly, outcome-oriented procurement, where we would try to avoid input specifications, technology-agnostic procurement, ensure quality of service by pre-mandating the SLAs, the standards and specifications, etc., and a single stage bidding. It could be a 2-envelope, or a basis the scale of the project, it could be a 2-stage as well. So in the phase 1, these are very, very, when you develop these documents, they have to be very use case specific. So we have identified one use case. The document will have some provisions which will be boilerplate provisions. The more project-specific provisions will be in square brackets with guidance notes, and which would be revised by the project authorities based on any new use case being considered. We will also be giving some pre-qualification criteria for participating in the tender, and we have been following a very open approach while coming out with these conditions. I'm not spending time on this, but we will be sharing the draft document soon, and whoever are present here and would like to work with us, please reach out, and we will be happy to share all the work that has been done and is under process, so that when we come out with a document, it is based on wider stakeholder consultation. This slide, we will be sharing this slide, so I will not read every slide of it. We also have, really done a lot of work on putting the evaluation criteria. What will be the evaluation parameter for identifying the companies who will be shortlisted? We wanted it to be very, very objective and not subjective. So that is the, purpose, to reduce the subjectivity in the evaluation criteria, which always is, leads to a more robust procurement process. Detailed terms of reference will be part of the contract, the RFP, so that whoever is bidding will know what the scope of the work is, and they can prepare the bid accordingly. For way forward, I would, again, some of our colleagues are here, they will speak about it, but I'm sharing my email ID, so feel free to write to me, and we will share the draft document as and when it is ready. It is a very, very laborious exercise. We are seeing that how difficult it is to identify the standards, specifically the technical standards. The other aspects are kind of clearer. But if you have any comments, please share that. And we hope to come out with, a draft document on January 31. This was added after I had cleared the slide. So I was hoping it would be earlier. That shows how difficult the work is, and the team is working on it. But since we have written January 31st, we'll come out with this draft document for discussion by January 31st. WEF is a partner. The startups are a partner. QCI is present. They are also partners in this exercise. States have been consulted. Some of the state representatives are here today. So whoever we have not reached out and are in this room, or you know somebody who can be contacted, please send an email and we'll reach out to you. Thank you. And now I will request my colleague from QCI to briefly explain the philosophy of the regulatory regime, which will be coupled with this procurement process. Thank you very much.
All of you. And as all of us know that quality plays a very significant role as far as customer satisfaction is concerned, consumer satisfaction is concerned, and overall sustainable growth of any product or service industry. But still there is a misunderstanding or perception among all the industries that attaining and maintaining quality is a costly affair. And worldwide, number of surveys, independent surveys are conducted, and the result of those surveys shows that cost of attaining good quality is less than cost for poor quality. If we talk about expenditure on the cost of good quality, it may include design and development of systems and processes, documentation, internal audits, reviews, inspection, monitoring systems, and overall systems for competence and capability building of the organizations. But if we talk about cost for poor quality, it may result into non-conforming product or services, then customer complaints, litigations, warranty claims, and overall dent in the brand image or credibility in the market. So conclusively, we can say that cost of attaining good quality is always less than cost for poor quality. Now, this quality can be attained or managed through effective and efficient management of 6M. These 6 M's are namely man, machine, material, method, measurement, and mother environment. And further to this, if we talk about quality, safety, reliability, security, those can be attained through a structured system. And globally, if we see that there are 2 parallel systems exist across the globe, in a democratic setup like India, if we see in the right side, acts are being passed from the parliament. There are sector-specific regulators like CDSCO in the medical device sector and pharma sector. There are FSSAI in the food sector and DGCA in the civil aviation sector. Those regulators are supposed to oversee the legal compliance, regulatory compliance, or compliance related to rules, regulation across the sectors with respect to oversee and surveillances. And they are supposed to issue approvals and license of different product, process, or services. At the same time, there is a parallel system exists in the right side, which talks about a voluntary third-party accreditation system or conformity assessment system. This system is governed through a third-party independent conformity assessment body or certification bodies, which are being accredited by national accreditation bodies, which are part of regional system called APEC, for example, Asia Pacific Accreditation Corporation in case of India. And this regional group is part of International Accreditation Forum, which is an umbrella body for this entire accreditation system. So here we can see that certification bodies are supposed to do conformity assessment exercise in terms of testing, inspection, and auditing. And those results can be produced in terms of conformity assessment outcomes, in terms of inspection reports or certificates, which are being issued by those certification bodies. So if we integrate those systems, so we can see that this can be in line with the PPP model, where this voluntary system can support regulatory system, and we can attain quality, speed, scale, and sustainability for any product or services in respect to different level of compliances. So this voluntary system is based on key principles like impartiality, competence management, risk-based approach, and through this entire exercise, this global equivalence is being achieved through certification of product and services. So whatever is being certified under this system, for example, India, if a certification body is certifying any product or services, that will be equivalent to any global certification under this system. So through this system, we can attain speed, scale, quality, and global equivalence as well. Now, in line with this system, what Quality Council of India does, that we create certification scheme or framework according to those requirements and needs of stakeholders. So as a scheme owner, we are responsible for design, development, maintenance, and administration of conformity assessment solutions or conformity assessment schemes. So these schemes are being designed and developed through the engagement of various and relevant stakeholders like industry bodies, academia, testing laboratories, standard development organizations, regulators, and other entities. The intent is very clear that the conformity assessment scheme, which is being designed by Quality Council of India, that should be designed as per the needs and expectations of all the stakeholders. It should be technologically feasible, administratively doable, and scalable. And Indian context, we can say that sometimes it should be emotionally relatable with the need of all the stakeholders. So in line with those requirements, Quality Council of India and DGA signed an MOU in 2019 to develop a certification scheme for drones in India. And in line to these requirements, we have come across with a detailed certification scheme, which was published in 2020. That was the first version. And after release of Drone Rules 2021, that scheme was updated accordingly. And in Jan 2022, the second version of the scheme was published. Now this scheme is designed on the basis of International Product Certification Standard, which is ISO 17065, which is globally accepted as a product certification standard. This scheme, entire documentation and certification criteria is available on the Quality Council of India website. It is a very simple document which can be implemented by any manufacturer or startup who is interested in quality and systems and processes into their manufacturing setup. So this scheme has got 10 clauses which talks about general requirement, for example, class and categories of drones. Right now, there are 5 categories of drones are being defined in terms of nano, micro, small, medium, and large. Presently, no certification is required for nano categories or model RPAS systems. But for all other categories, this type certification is a must requirement. So here we can see that this entire process of getting type certification is digitized. There is a dedicated portal called Digital Sky Platform, where any startup of manufacturer can apply for type certification. He is supposed to submit that D1 form on this portal, and he has to submit all the associated documents in terms of manuals, procedures, operational manual or maintenance manual, testing reports for batteries, testing report for RF modules, EMI, EMC test. All those reports need to be submitted by the manufacturer. And once the entire set of documents is being submitted on this portal, he is supposed to select a authorized testing entity. He has got a freedom that out of number of certification bodies which are approved by Quality Council of India, they can select any of them on the basis of their commercial arrangements. And this entire process is a time-bound process. This within 60 days, a certification body is supposed to issue a statement of conformity on the requirements, or they are supposed to reject the applications. Once that statement of conformity is being generated, it is being shared with DGCA for their final decision, and within 15 days, DGCA has to take the action on the final decision. So once this final decision is being taken, so type certificates are being issued for any applicant or manufacturer. Once a type certificate is being issued for any model, they can produce n number of models according to the type certificates with unique identification number. So this is a very simple and robust process. Entire process is transparent. Yeah. Please.
Sorry, brother. We'd like to welcome Secretary Civil Aviation, Mr. Rajiv Bansal, who's joining us. Welcome, sir.
Welcome, sir. So this entire process is a very transparent process and time-bound process. Certification bodies are supposed to conduct due diligence of all the documents and systems which are being produced by the applicant. And all those requirements are being addressed in the certification scheme. in a detailed guideline is also published on QCI website, where any manufacturer or startups can go through those guidelines and they can understand those requirements accordingly. Now, once a type certificate is being issued to any applicant or manufacturer, whenever there is any change in the scope of that drones or US system, for example, there is a change in payload or some configuration, they need not to apply for a fresh type certificate. They can straight away go to the portal and they can apply a change of scope exercise, and they can get the revised type certificate accordingly. Now, here we can see that till date, we have approved 3 certification bodies, out of which 2 certification bodies are multinational certification bodies, and 1 certification body is Indian certification body. And 5 type certificates have been issued till date, out of which 3 are in agricultural sector and 2 are for survey applications. There are 9 statement of conformity which has been submitted to DGCA for the decision, and we are hopeful that shortly they will issue type certificate on those SOCs as well. And there are 24 applications are in pipeline. So we can see that there is a good progress in terms of processing of those applications for type certificates, but still there are certain challenges. And as in QCI, we understand that those are teething troubles. We are trying hard to understand those challenges, and we are trying to address those challenges. For example, the biggest challenge is in terms of competence requirements, because a lot of manufacturers are startups and they don't have competencies in terms of design engineers or drawing professionals or testing staff. So preparation of design document is the biggest challenge as far as current scenario is concerned. And we are organizing a lot of workshops and sensitization programs through various industry associations like DFI and FICCI, and hopefully that issue will be resolved shortly. The second issue is related to this functionality of a digital sky platform. In certain cases, we have seen that all the functionalities are not available. So we are also seeking guidance from Ministry of Civil Aviation and DGCA that those functionalities should be available as early as possible, so such type of challenges can be addressed accordingly. So overall, I can say that once this scheme is matured and implemented in the true sense, this scheme will help in enabling, creating an ecosystem for world-class drone manufacturing in India. Thank you very much. And if any query, I will be happy to address this. Thank you.
So, welcome, sir, for today's event. Just by way of briefing, sir, since he could join a bit late, we started off by explaining about the Medicine from the Sky project, what were the learnings and what is the way forward. Before that, Dr. Paul emphasized that today's deliberation needs to be interactive because we are using today's event to chart out the way forward on how to embed new technology for promoting public healthcare system in the country. I spoke about streamlining the procurement of drones as a service following the budget announcement, which is being done in collaboration with Civil Aviation Ministry under the drone mission, which is being also steered by Civil Aviation, where NITI is providing the support to the ministry. In the procurement process, while the documentation is still being worked on, we have given a hard stop of 31st January, when we will be circulating the first draft. We are at an advanced stage. There, following the infrastructure sector approach of outcome-oriented procurement and giving detailed standards, specifications, SLAs, and very, very objective evaluation, I kind of briefly gave the philosophy which we are following. QCI explained the certification process as it stands today. And now, sir, we will be hearing from states also. But if there are any questions at this stage, we will not answer it immediately, but perhaps at the close of the session, Secretary Civil Aviation could address that. So any questions before we call the state representatives to share their views? So I think we have been so very clear. There is no confusion, sir, as of now. And with that, can we call the state representatives now, Vignesh? Over to you. Pardon me?
Just I want to know if any manufacturer, leading manufacturer in India so far on the manufacturing of drone.
Okay, noted.
Let us know about this status and thank you.
Thank you. Any other questions? So, sir, I'm sure will be. Thank you. Thank you. So, over to you, Vignesh, for the state interaction.
Thank you, ma'am, and welcome once again, sir. So taking our discussion on medicine from the sky forward, I think the next section will be more around how states have worked towards the implementation. Right now, of course, since the liberalization, we've seen a lot of pilot programs running, but what we need now is a middleware from pilots to actually scaling. So if I can invite Shri Vivek who's the Special Secretary Health, Government of Arunachal Pradesh, to take us through a small presentation.
Vignesh told, we will keep it very brief. The video will summarize the initiative that is done in the state of Arunachal Pradesh, please.
An area of 83,743 square kilometers in the Himalayan ranges with a very sparse population density of just 17 persons per square kilometer. Arunachal Pradesh faces extreme challenges in maintaining the supply chain of medicine, equipments, etc. in order to provide proper healthcare services to the people, especially the areas where there is no proper road connectivity. During monsoon, it becomes more difficult since most of the places are cut off from the rest of the world due to incessant rainfall and landslides.
A prime example of such an effort is seen in Arunachal Pradesh and on your screen. Visuals of healthcare workers making way to the remote Gandhi and Kachin villages under the mining circle of Siam district.
Arunachal Pradesh has started using autonomous electric drones in healthcare supply chains. Given the unique geographical terrain of Arunachal Pradesh, not only will drone deliveries be faster than land logistics up to 10 times, but they will also lead to improvement in health outcomes by ensuring delivery of essential and emergency time critical medical products like snake antidotes, vaccines and diagnostic services to deep rural and tribal areas. Drones are known to achieve up to 99% reduction in carbon emissions when compared to traditional van-based land logistics. Drone systems can reduce infrastructure footprints in multiple ways apart from reducing the number of vehicles required. Long-reach aerial hub and spoke systems result in fewer middle-mile medical supply chain points and laboratories. Considering all these aspects, in February 2022, the state government and World Economic Forum signed a memorandum of identified for the execution of pilot project Drones for Social Impact Medicine from the Sky project. Two aerial logistics partners, namely Red Wing for East Kameng and Ted Eagle for Lower Subansiri, are involved in the pilot project. The state of Arunachal Pradesh is on the path of accelerating the use of sustainable energy and clean transportation to lower carbon footprint in the delivery of healthcare services to the people.
Yeah, so thank you all for watching the video. I'll keep the presentation very brief since much of the information was there. Yeah, so if you see the timeline, I mean, we didn't want to waste much of the time since we signed the MOU with World Economic Forum. Within the calendar year only, we have launched the pilot study in both the districts, and the results have been very encouraging. Like we described it in the video, that Arunachal has a difficult terrain wherein which road connectivity becomes extremely difficult, especially during monsoons and the frequent landslides that keep happening over there. And the field recce and the pilot study that we have done through drones for supplying medicines to the far-flung PHCs has provided us very encouraging results. When it comes to, if you see, one of the key takeaways for us learning here has been that the public participation for this initiative has been quite encouraging. Most of them were enthusiastic about seeing a drone that is being used to deliver medicines to the remote possible areas. People came in large numbers to encourage this initiative whenever the test flights were being conducted. The stakeholders, naturally, like with the state government, we have the district administration and the health facilities, and the multilateral organization, which the World Economic Forum has been very instrumental in helping us in bringing the stakeholder partners, such as the drone operators. Ministry of Civil Aviation has given us a very good cooperation in this regard, because this has been our first learning experience. So, sir, we thanks for the cooperation that and the guidance that we received from the Ministry of Civil Aviation as to how to go about it. Arunachal being a border area, getting clearances from the red zones and all was quite challenging. This again, like how like two districts were connected, if just to tell, Arunachal, each district has a different tribal culture. So when in one of the pilot studies that we conducted in Lower Subansiri, that would act as a drone hub for us, and from there we connected one of the remote possible PHCs in Kradadi district. Both are of different tribal background. So drone also acted here as an instrument of bringing people together. And they exchanged pleasantries. There was a lot of warmth amongst the people when this was launched, and indeed it has been very engaging. Very encouraging for all of us. The role of the state, what we are saying here, is the engagement as being a collaborator with the multi-stakeholder engagement such as WEF, and we also had the project performance evaluators with us, such as PHFI and PATH, and the clinical and training partners such as Apollo Global Health. The external bodies, like I mentioned, Civil Aviation Ministry already, the Eastern Command and Advanced Light Grounding divisions. On the enabling front, the state is providing facilitation in terms of the field level implementation, coordination with all the stakeholders. And of course, what we have experienced is this can act as an instrument to create a job creation in the state. Most of our youth are getting skilled in this regard as drone operators. They're showing some enthusiasm in this phase. So that is a very good key takeaway for us. And we're also thinking of, in fact, we have started a drone port construction that is happening in one of the districts, in one of the pilot districts. And the roadmap for, as far as Arunachal, we would start with a straight drone policy. And then the operational guideline, the quality certification, the QCI team mentioned, we paid attention to that. I mean, we will have to have more inputs on that regard as far as the implementation strategies are concerned. And definitely, we in the state feel that the drone is going to be a force multiplier in the health setup in the days to come. Thank you very much.
Thank you, Vivek sir. If I can invite Shri Ramkumar, Additional Secretary Health, Government of Meghalaya.
So, good afternoon, everyone. I think the previous speaker, my colleague, has already made a case for why drones are so important for particularly the northeastern region in terms of medicine, drug delivery, and other things. So the pain points and intervention, I'll just go to the current status. We have already finished and probably inaugurated the first what we call as a drone station. Some of them are having a drone port or drone things. We have already constructed, and it is a daily operational drone station in Meghalaya. And I think this is probably the first. We made our checking and probably the first in the country, I guess. And this was inaugurated on the 5th of December. And we have already 25 health facilities have been identified in the network. 5 facilities already have, they have almost done 2-3 multiple entries in the last 10-12 days. And the remaining 20 will be done. So I think Mr. Vignesh was mentioning 29 PHCs is going to be covered. Within January end or February, we will be alone, Meghalaya alone will be doing 25 PHCs. So of the 50 in the whole country, 50% would be in Meghalaya only. And what does it mean is basically we are seeing this as a new form of transportation. We are not going to look at only for healthcare. The flaw is going to be there when you're going to look at only for healthcare. We are going to look at for multimodal commodity transportation, not just for healthcare products. So this, since companies are also here, we'll have to have payloads which has to go for both ways. It cannot go in one way. We would like to create, I mean, like a mini Indigo of drones only. Only that is going to make it ultimately efficient, cost effective, and timeliness. Otherwise, it's not going to be there. So we are next looking at to agri inputs, because in small states, the agri inputs and agri produce are all low volume, but high quality. They have a very niche market, but they're not able to reach to the market because of the lack of volume, but they have, and the transportation cost which is involved. So if we can replace that, I think it will be a fantastic game changer. And of course, we'll have for emergency purposes, particularly during monsoon, like Mr. Vivek mentioned, where we need to deliver some medicines, emergency. This year, there was a situation where we had to demo, but that time only we were completing our exercise, so we were not able to do it. But next year, I hope, if we'll not have floods, but if we do have, we'll be able to then. And we have a daily pre-planned flight plan. So there are 5 to 8 flights planned per day, depending on the requirements. So that is how we go. We'll show a small requirement on that. This was the first demo which we had done in West Khasi Hills of Meghalaya. This was in the year November 2021. After that, we have increased. So you can see that the pin is where the drone station is there now. And the red line is the red zones, which is bordering Bangladesh. And we have, these are the areas where we are already started. And there are 20 more locations in the area which will be completed within next 45 days. And these are the first phase which we have done already, medicines, vaccines, supplies, and we're doing reverse diagnostics also. We have already completed some blood samples which has been completed. And if you look at, these are the flights which have been done since 9th of December. So we have done these many flights. The total 20 hours or 22 hours by road in 4 districts from this particular location has been cut down to less than 5 hours of time. So that's the efficiency which it can bring. We're all aware of it. So these are some of the pictures where multiple landing pads have been made. So we have already identified how landing pads have to be made, what kind of training is probably required, who is to be trained in a health facility, and how do you create a network. So we are going to, we are already creating a network of how to make it this even more regular. And this is how our future plan if we can establish 4 drone stations. The present drone station, what is there is more of an extension of our proof of concept, so that in fact how the network works, how can we reduce the cost and increase efficiency. If we can set these 4, most of the state can be actually covered. And we are not looking it as a supplementary mechanism for drug transportation. We are looking at actually alternating the entire space of transportation. Only that scale we are thinking of working, so that it will be a new mode and it will be faster for us. And the key takeaways and going forward is this. It has to have an hub and spoke, so we already have that. Product range should be wider. It cannot be only for drugs, and it should not be demoed like that, because that kind of demo will actually not result in escalation quickly. And we are trying to have an integrated phone of a helpline network, which we already have. Thanks to COVID, we had an integrated helpline now. So any medical officer can call and they can say what I require, and that will be placed as an order. And then from the drone station, the operators will actually make a map and deliver. The bottom line should be clearly defined. Why we are doing this in any particular state. For Meghalaya, it goes from entire range, from efficiency to time saving to saving timely lives, particularly tests, blood, and to environmental concerns also, because as he rightly mentioned, it's very, very energy efficient. And finally, helping communities to adapt to the new technology. If we don't take them to the community into this technology, there is always a fear when something new comes. I will leave at the final video, just think to sum up the entire thing. Does the video play? Can you just click the YouTube link?
Can you also tell whether did you face any challenges, bad weather? Were there any accidents?
No, sir. We had.
Is it all BVLOS?
This is BVLOS.
So can you give us maybe after the video?
Yes, sir.
And where do you pick up these supplies from? So is it like a warehouse?
It is actually located in a hospital itself. So I'll show in the video. It will be clear. We can go to YouTube. It's there on the YouTube already.
It has to be integrated within the health system
Yes.
of the state.
Yes. It can't be outside.
That happen?
Yes, sir. Because I'm both mission director, National Health Mission. So I'm from the health department, and so it is with that.
Meghalaya is known for its beauty of its hills. In all its beauty, there are challenges. Accessibility is one of the biggest challenges that we face in Meghalaya, and because of poor accessibility, especially in rural areas, medical healthcare has become a big challenge.
Many of the areas are cut off during monsoons, for example. Many of the areas are hard to reach areas.
Kalau bisa bang sorangan dia sumsang nasa sini deh, kalau di cita roti, kari manjani kaman sahabat ko ba ang napa manjani, aro vaksin ko ba ordnani kanina ko manaya.
These are things that are inevitable. These are some of the biggest challenges that we are facing as medical professionals, especially in the state of Meghalaya. India has made incremental improvement in terms of using.
This is the drone station, which is located in the hospitals.
Meghalaya has actually taken 2 steps ahead by introducing the innovations in health by using the drones for the supply of medicines and several essential drugs to hard-to-reach areas.
This is very unique, not only for Meghalaya, but for the entire region as well as for the country, because this is the
Yes. Thank you. So the challenges initially was, how do you even set it up? It was so new. How do you even set it up? This thing was actually a challenge because we were not able to figure out from elsewhere, sir. So then we had to finalize places and we had to recce things and setting it up. How do you make flight plans? All those things are there. We are also learning as we are going. So once we extend, only then we'll get to know even more challenges. So here in this hospital, there is a mini warehouse. There is a pharmacist to coordinate with all the health facilities which it's going to supply, who will take what is required on a daily basis, and then the flight plan is made and then it is delivered. In terms of whether we have actually, including what flights, what I already showed, we have, I think, close to 30-35 flights have already been made. So we are waiting to see more inclement weathers to figure out how it is understanding. Meghalaya weather is not as unpredictable as probably Arunachal weather is, but it is still also extremely unpredictable because of the terrain. So we will have to see in another 3-4 months what kind of challenges. The next key is that we want to increase the payloads. If it can increase to 20, I mean, we are thinking of if the technology catches up with 25 kgs, I think that will totally replace our, and if all the clearances and the legal clearances are there, I think it can totally replace our mode of transportation itself, at least for drugs and agricultural produce to start with. Thank you.
Thank you, sir. Briefly adding to that is, every district we go to, we've seen drone and non-drone problems. So I think those are things that we've been working towards creating this whole library of issues. So if I may invite Mr. Neil Lalka from the Maharashtra State Innovation Society. Neil, if I can request you to keep the presentation as issue-centered, what is your expectation from the stakeholders involved, if you can touch upon that for the Honorable Secretary.
Good afternoon, ladies and gentlemen. I'm Neil Lalka, and I represent the Maharashtra State Innovation Society. Along with me, I have my colleagues Amit, Ruchi, and Vivek in the forum. Brevity is the soul of wit, as Shakespeare said, and I'll try and be as brief and fast as possible today. I represent MSINS here today. MSINS was set up in 2018 as the nodal agency for startups and innovation in Maharashtra. We are the ones who've been supporting drone technology in the state along with other emerging tech. I'll quickly take you through the kind of work we've done. Our work has been recognized by Startup India and DPIIT. We're in the top performer category in the state startup ranking framework. We've also been acknowledged by the Capacity Building Commission and the Rajiv Gandhi Awards for Public Administration Excellence. Niti Aayog has ranked Maharashtra 4 in the National Innovation Index. Proud to say that 25 of the 108 unicorns are from the state today. A couple of our ongoing initiatives which are supporting the innovation ecosystem at large. Startup Week is something which is our flagship initiative through which we support 24 startups with a work order of 15 lakhs every year. These include startups working in technologies like drones, robotics, AI. I'll take you through a few quick case studies. We are also setting up 17 incubators across the state which support startups working in emerging tech. There is financial assistance for patents and quality testing. We are also in the process of setting up the Maharashtra Innovation and Technological Development Fund, which will be a 200 crore fund sponsored by the state government to invest in deep tech, high-impact startups. Startup Week, which I just briefly told you about. I'll jump to the few use cases which I've shortlisted. Purushottamji spoke about cancer screening as one of the key problems, and 2 of our startups have worked extensively in this space. Niramai, who's worked in breast cancer screening, has brought down the screening time to 15 minutes using AI and thermal sensors. Periwinkle has developed a cervical cancer screening, which is one of the most common cancers in women in India. The screening time has been brought down to 7 minutes. The charm here is that both are non-invasive. That itself, solves a lot of stigmatic issues attached to cancer screening in India. Talking of autonomous technologies, we work closely with Sagar Defense, who developed a surface water cleaning drone, which was deployed in Pimpri-Chinchwad, Pune after the Ganesh Utsav and managed to collect over 5 tons of waste in less than a week. Planis was somebody who developed an underwater surveillance drone for us, which was deployed at the Badsa Dam. which is one of the largest dams in the state, supplies water to the city of Mumbai. And all sorts of defects were identified using this particular ROV. Prior to this, this was something which was done manually. In terms of drones, we've done a few pilots so far. Blue Infinity deployed their drone in the rural district of Palghar, solving a big issue of inaccessibility in a tribal area. The drone was used to deliver vaccines from the district headquarters to the primary healthcare center. Similarly, Volar Alta Niharika is present in the audience today, and she had done a pilot for us in the Pune rural area, specifically in the Manchar region, and we found that there was time savings of at least 80% in both the pilots. Maharashtra perhaps is one of the few states which has a fund dedicated for defense and aerospace. It's a 330 crore fund largely deployed as of now, and we made a few key investments in the drone space, namely Saga Defense, Paras Defense, Aman Aviation, and Cyronics Instruments, which specialize in anti-drone systems. Going forward, we'll also have the Maharashtra Innovation Fund, which will get active and which will again be a sector-agnostic fund and will support deep tech startups in the drone and the robotic space. So to summarize, what all is Maharashtra doing for the drone ecosystem as of today? One is equity financing through our two venture funds. MSINS directly provides grants of up to 14 lakhs for any kind of patents and quality testing which a startup may want to avail. Under the industrial policy, the package scheme of incentives, and the upcoming IT policy, there is going to be a strong focus on emerging technologies which will provide fiscal incentives. MSINS is someone who's always open to facilitating and funding pilot opportunities for high-impact startups with the government. I've already spoken about the incubation support as well available to early-stage entrepreneurs. And our ITI network is working towards skilling in drone repair and maintenance. A couple of points for deliberation today, which we would be open to discussing with the ecosystem at large. We've done pilots nationally. How do we take them mainstream beyond the popular use cases of defense, healthcare, surveillance, agriculture, and beyond? Should states be focusing on creating, expertise within each line department so that, say, an agri department knows how to work with drones? Or should there be a central drone authority who has that expertise and helps each department work with, drones and the entire ecosystem? Responsibility management, what kind of liability management issues can crop up with insurance agencies and other stakeholders? And pricing related issues, which Anna ma'am spoke about earlier today. I'm sure those initiatives will go a long way in finding a way through these issues. Thank you so much, and happy to take any questions offline.
Thank you, Neil. I'd like to invite Dr. Rakesh Dubey, GM, Madhya Pradesh State Electronics Development Corporation.
धन्यवाद नीति आयोग and Ministry of Aviation. Started work on healthcare currently using the drone. Yes, thank you, sir. But we are started our services using the drone from 2019 onwards. This is the background. MPACDC is a nodal agency for implementing the drone and GIS, human sensing, and AI, ML in MP states. So MPACDC has completed the drone standard and policies also prepared. And this is the office copy of this. And this is our journey of MPACDC drone unit journey, you can say. We have established a drone unit inside the MPACDC. And where we are providing the services and some pilot projects to other government departments where we are just highlighting the uses of the drone so that they can adopt the technology and they can make it compulsory to use this technology for the vendors and other things also. These are our stakeholders, and the work done in the MP state by the MPACDC is just I am just briefing the sectors actually. The mining sectors, we have done some work for calculating the area actually. for road transport also, we have done many works to execute this area. And currently, road department has taken this in mandatory for preparing the road and any proposal what they are preparing. This is for the road, actually. Benefits also we have provided to the government departments actually so that they can adopt this technology. Property sectors also. This is for what we have done for property sectors, RERA and other things. For water resources also, we have done many projects. So here what we are talking about, ki many sectors we have touched here in Madhya Pradesh. We are utilizing of the drone to get the images and using the AI/ML. And what we have done in the using for, as we're talking about the health sector, to transport the organs, human organs from one place to another place, we are discussing with the AIMS currently now. आर्कोलॉजी डिपार्टमेंट के लिए भी हम लोगों ने कुछ काम किया था वहाँ पर, जिससे हमने 3D क्रिएट करने की कोशिश करी थी उनके लिए, आर्कोलॉजी डिपार्टमेंट्स के लिए। एग्रीकल्चर सेक्टर के लिए रिसेंटली हमने एक काम किया है जिसमें ये है कि कम से कम वेटेज हम उसको यूज़ करने के लिए बता रहे हैं कि इतना वेट कम से कम होल्ड करके यूज़ किया जा सकता है स्प्रे करने के लिए। पुलिस के लिए 2016 में हमने सपोर्ट किया था जब कुंभ का मेला उज्जैन में लगा था मध्य प्रदेश में, तब पॉलिसिंग के लिए इसको यूज़ करना सबसे पहले स्टार्ट किया गया था ताकि मॉब कंट्रोल के लिए, ट्रैफिक कंट्रोल के लिए इसका यूटिलाइजेशन को बढ़ाया। सबसे पहले एमपी स्टेट में डिपार्टमेंट्स ने इसको पहचाना था कि इसका यहाँ उपयोग ज़्यादा किया जा सकता है। हेल्थ केयर के लिए मैंने आपको जैसे बताया कि हम लोग अभी एम्स के साथ बात कर रहे हैं ह्यूमन ऑर्गन्स के लिए, जो ग्रीन कॉरिडोर बनाने पड़ रहे हैं कि इंदौर और भोपाल में सबसे ज़्यादा ग्रीन कॉरिडोर अभी तक बनाए गए हैं कि एयरपोर्ट से लेकर हॉस्पिटल तक या वन हॉस्पिटल टू अनदर हॉस्पिटल। सो वी आर डिस्कसिंग विद द एम्स करंटली इन भोपाल। थैंक यू। Any questions?
Thank you, sir. In the interest of time, we will actually club the next two sessions where we also have startups and key stakeholders from the system. So we have mics that will do the round. I'd like to invite, I'll actually call out a few names. If I can invite Anshul to start with, just to share. I'll beam a slide on screen. You may have a set of questions. If you can touch upon that as to how you would like the program to be improvised. If you can. Yeah, so you can actually stand in your place, and then from Anshul we'll move to Niharika and then Vikram, and then we'll open it out to the floor in the interest of time.
Sure. So quickly, my name is Anshul Sharma. I'm one of the co-founders of Red Wing. As Mr. Vivek mentioned, we're currently live right now in the East Kaming district. It's been 4 months since the time that we've gone live under the Medicines from the Sky program in East Kaming district. And I think, over the past 4 months, what we have realized is that this has become less of a drone program and more of a healthcare program per se, right? And what I mean by that is when you're specifically operating in northeastern regions, your main challenge becomes that will the Scorpio break down when you try to go to the hospital, essentially when you have to do training for the layers. So what I'm trying to say over here is that on the first point, drone delivery programs for healthcare are such a deeper integration within a network that drones probably constitute about 30 to 40%, but the remaining 60% is doing the training for the PHC staffs, CHC staffs, ANMs, nurses, all of those modules part. Secondly, what we have realized is that India's healthcare system has multiple programs, right? You have the malaria program, the TB program, the immunization program, so on and so forth. And since we've gone live, I think we've had 4 or 5 delegations from each of these programs. Now the incredible thing which happens is that when a person from immunization program came and he saw that that vaccines were getting delivered by using drones, he was like, "That's wonderful." The second delegation happened, and malaria delegation came, and they saw that malaria samples were getting screened through drones, and they also had the same reaction. Same thing with TB and others. But what we realized as outsiders was that all programs in India are essentially running in silos. And malaria has its own supply chain, TB has its own supply chain, immunization has its own supply chain. So, whereas drones, when you're doing a program through drone delivery, you're essentially bringing all of them together and giving incredible amount of visibility to all stakeholders in terms of consumption patterns throughout. The second layer which happens, and I think which often gets missed out, is that why use drones, right? Is it useful for doing emergency care? Is it useful for bridging only accessibility gap? I think, if we're right now, I think in the BKC of Mumbai, right? So over here, you're able to get diagnostics done within same day, which is about 90 minutes is when your diagnostic collection will happen, and within the same day, a diagnostic report can be generated. This is only possible in the top 4 metro cities by using traditional logistics. But drones is now enabling that in regions where it's outside of the top 8 metro cities, especially in regions like Arunachal and other parts as well. Right. So on-demand diagnostics and unlocking, I would say healthcare 2.0, which is only available to the urban masses, is getting unlocked through drones, through drones in these networks. And third layer, I think fundamentally, is that when basically you're essentially activating PHCs and CHCs, which earlier were either dormant or were having very low consumption pattern throughout. When from the point of view of a patient living in a rural region, they had to spend close to 3 days to go to the main district lab, get their diagnostics done, and get the report done on that part, right? That 3-day window, combined with the fact that their traveling and expense part is anywhere between about 5,000 to all the way up to 20,000 in terms of travel, stay, and all of those layers. That 3-day window is now getting compressed within a 6 hours window, where they don't have to travel to the main district hospital, about 30-40 kilometers, and just come to the nearest collection center part. By virtue of that, consumption itself is increasing, and this is what has happened in African part as well, that Africa earlier started with blood, but India has started with diagnostics, medical supplies, and other parts. So as routine care is getting more and more predictable to the last mile in the PHCs and CHCs by using drone delivery, we're seeing that the consumption patterns itself and the footfalls are going to increase essentially to the PHCs. And I think that is going to be a really game changer moment as well for the ecosystem. So yeah, that's been, thank you.
Thank you. If I can, Niharika, so we'll just keep it short. One roundup of the work that you've done, one regulatory challenge, one operational challenge, and if you can.
I'll speak in bullet points, no problem. Sure. So my name is Niharika Kulte-Halekar, and I'm the founder of a drone venture called Bolar Alta. We got an opportunity to do one small pilot in a village called Mansar, which is close to Pune. We tied up with the KEM Hospital Research Center in order to understand the on-ground realities, So I will talk about 3 things that worked for us and 3 things that didn't work for us. We got a positive feedback from the rural health centers when we tried delivering medicines, vaccines, and saline bottles while maintaining the cold chain. We did not use ice packs, but we used a Peltier system. We could garner community support through sensitization workshops and training sessions with the district health staff, ASHA workers, so on and so forth. And we got an opportunity to do a deep dive to understand the problems of the existing supply chain in all of these villages. The challenges that we faced, again, three fronts: technical, infrastructure, and sustainability. Technically, the drone that we leased out was not able to fly when the outside temperature was about 40 degrees, and we conducted these trials in March. It was not even able to traverse a distance of more than 20 kilometers with a 5 kg payload. Infrastructurally, there was a lack of network coverage, unavailability of technical skill human resources. And finally, in terms of sustainability, the stakeholders at the PHC in Mansar confirmed that this solution would be useful only in emergency cases as of right now. For example, blood deliveries in case of accidents or postpartum emergencies, and for sample collection. Furthermore, amending the existing legacy supply chain systems and integrate the drone tech seems a little far-fetched because of unfavorable unit economics, lack of trained staff, and capacity constraints of the drones to service the actual long-range requirements. Some of my learnings and observations in this project, I think it's important to understand that there are different pain points for different geographies in this nation. So we need to refine the business models, and we need to work a lot on improving the unit economics in order to achieve a techno-commercial viability. We know that Zipline is a global case study. We know that it has been able to set up a resilient and a reliable supply chain after operating for 10 years. They started with a war chest of 100 crores of government of Ghana, who supported them with that kind of a government contract, and that's how they started. As of today, they have more than 3,900 crores of funding with them as the war chest in order to kind of set up the whole system. So when we are talking of unit economics, we know that Amazon, who has been trying to do this, recently they said that they are targeting to achieve a per flight cost of, let's say, $65. In India, we're considering that same price to be in the range of 50 rupees to 100 rupees per kilometer. How is it that startups will ever be able to bridge that gap? And the unit economics, how is that ever going to work out? The drones are expensive. We do not have the infrastructure. So there's a lot of work that needs to be done collaboratively in order to achieve what we have set out for ourselves. The last point that I'd like to make here is, we have seen that there have been a lot of pilot projects which the state governments have been taking up. It has resulted into some amazing things like standardization of forms, guides, SOPs, etc. However, we still do not have the access to the actual detailed documentation around the numbers, around the learnings, costs, economics, etc. And since this is not publicly available as of right now, we do not have enough data points to analyze and overcome these challenges. To conclude, I think we need to invest a significant amount of time in experimentation and testing in real-time situations, and designing solutions that are tailored to the local needs. I think it's important for the entire industry to succeed as a whole. We must absolutely pay a lot of importance to unit economics and ensuring that startups are winning along with the government and the state health departments. Finally, I'm very happy to discover today that all the stakeholders are willing to work together, and I think they've been made accessible to us startups through this forum, so I'm grateful for that. My appreciation and best wishes to World Economic Forum, Civil Aviation, and the state health departments for launching Medicine from the Sky program. I look forward to contributing to this impactful project in every little way that I can. Thank you.
Excellent, thank you. Any quick reactions before we move to the next speaker?
You talked a lot of unit economics, and what is your tipping point? Do you have an understanding of that? And
Yes, sir. So while I do not have as much experience as the other players in the system as of right now, as per my analysis based on the small pilot project that we did, the cost of the drone itself was 25 lakh rupees, right? So in order to bridge that gap with a target price of 100 rupees, we have to do
100 rupees what? 100 rupees per kg? No.
Per kilometer.
Per
kilometer. We will have to do at least 20,000 kilometers to be able to just cover the cost of the drone. So definitely that is something that we need to work on.
And also the lifespan of the drone in that 20,000 kilometers. So since we're on that topic, we'd like to invite a manufacturer, Kishan Tiwari, if you're here from TSAW. Are you there? Yeah. So if you can validate or just line up with what Niharika just mentioned. How do you write off a drone? What is the lifespan? How many sorties can you potentially do?
Yeah. So hi everyone, I'm Kishan, founder for T-Shirt Drones. We have been doing building drone network across the country. So what Niharika just told, actually, it was for a model. Then now there are some different models that we have for us. We have been experimented with. So we have been able to even bring the cost down to 4 rupees per kilometer per kg. So that's the potential the drone logistics has right now, and even that can go on further. So what we are doing, I think state representative for Meghalaya sir has told right ki it is not more about healthcare. It is more about the network that we are building. So let's consider drone logistics as like parallel to an alternate mode of transportation to highways, to rails, so that the network can be built upon hub to hub, multiple hubs, mother hub, and small micro drone hubs. And then that the same network can be used to cater down to multiple use cases, like starting with healthcare, where the value of item like is far more than other goods. But yeah, the same network can be leveraged. So we have been successfully doing some like deployments for some routes in multiple regions across the country with top e-commerce, top e-pharma companies, and we have been like. So so far we have been seeing this segment as more from a drone perspective. It's time to see it more towards a supply chain perspective. Like even national logistics policy, Prime Minister have launched, and the whole intention is to bring down the GDP keyword bar 12%. Say we have to bring it down to under 10%. So that's the whole intention. Ki once this network will be there now, so it can like offer as the complete alternate, and it can actually propel the whole growth strategy for the like 5 trillion economy that we have. Because like logistics is the backbone of the economy, and if this logistics will be in place as an alternative, so the whole like mass can be changed. So this is what we believe in, and we are working towards it. Yeah.
Question: have you been able to write off a drone based on the value that you just gave, per kilometer value?
Yeah, we have been able to. So actually, we have been.
Can you share the economics and the numbers if you can?
Sorry.
Whatever possible, can you share the numbers if you can, very high level, if it's possible. On a very high level, can you share some of the?
Okay, so actually for us, our drone has around 75,000 to 1 lakh kilometer of lifespan that we have. Right now, the costing per drone is very expensive. The initial capex, like since the ecosystem is not at that developed and it is developing, but that can be brought down in the coming future. So right now, the costing what we have been experiencing, so in the next 1 to 1.5 years, 12 to 18 months, we are seeing like 50 to 60% reduction in capex of the drone. And then in terms of OPEX, the major problem is with the battery. So the majority of the drone industry is using lithium polymer as a battery option, which is safer and do not catch fire. Yeah. So that's one of the thing. So even that can be switched to a more advanced solid state lithium ion battery, and the cost per delivery for OPEX can be further reduced to around 30-40%. So this is the number that we are looking. Even one alternate that we are working towards is using a graphene-based battery in the drone that we are experimenting with, and we have been successful with that. So yeah, that is another option that we are looking.
Any reactions? I'd like to invite ICMR if they're here. And do you have any quick reactions to what you've just heard? ICMR, I think Dr. Sumit or Dr. Harpreet, I believe, is here. Yeah. If you can take us through the 99 rupees per kilometer model, and how does that fit in with what you just heard?
Yes, it is actually high 99 when we go to the public sector, if we are delivering it through the 99. But definitely if we can get it the lower rate, that what he has said, like 4 to 5, then it would be the totally game changing. As what we have done in Nagaland and Manipur, that was 99 rupees per kilometer. But now we are using a case scenarios, more use case scenarios in Spiti, for journal and frozen section, pathological, oncological frozen section, and blood bags. So probably we will be out with our EOIs, and we are hoping good price we would be able to get more. Thank you.
Can you share any experiences from your most recent program in Nagaland?
Yes, actually we faced like all kind of difficulties in terms of technical and the both non-operational, like it was legal. And what you have said, the community participation, that was the most important, because people were very apprehensive use of drones because they have seen in movies and only in just war scenarios. But when we involved them as a part of our team, they were they helped us actually in making the environment more conducive for the use of drone. So that was the one thing. And apart from this network and the transportation of battery, that was the second important issue. Then non-availability of road transport, that is the second local issues that we have found there.
And a quick viewpoint from you on how action here should translate to work on ground.
Yes, actually, we need to develop what you are doing in Meghalaya, that we need to develop more use case scenarios where we can use drone, because if we are using just one or two kinds of things, like just vaccines or other samples, that would be not more cost effective. So we would be able to, if we can use samples, blood bags, vaccines, so many things, and all together, and we can have a spokes model, and we have to use this model and we have to deliver into the state, then it would be more useful if we can show their efficacy in implementation in public health. Thank you.
Thanks a lot. If we can move to Vikram from Tech Eagle. After this, we'd like to move back to the states. We'd like to get some reactions from the state representatives present here after what Vikram said. Vikram, please keep it to 3 bullet points.
So I think in addition to other colleagues' points, here we are starting again the discussion around the prices, right? So first, are we up with the indigenized end-to-end technology? Are we up with the end-to-end regulations which enables this entire drone delivery network which we have been speaking? And then third comes, do we have the capability to scale to a level when we can expect a price of 1 rupees per kilometer or 4 rupees per kilometer? Rather than deceiving, let's say, the adopters and states and everyone, we have to talk about that how all of us together would be able to enable this ecosystem drone delivery network from safe operations, secure operations, as well as the scalable operations. And then eventually, at the end of the tunnel, we will be able to get the right unit economics. So today, from the operations starting from Telangana, Arunachal, Meghalaya, Uttarakhand, Himachal, and different states that we have been doing over last 2 years, the learnings that we have received is that there is a need, there is a demand, and everybody can agree on that. So to meet that demand, and if we are comparing both these things, like from ground logistics, it's not a right comparable. We need to compare with the outcome, with the value creation that the drone delivery is doing. So how drones can actually increase the universal access of the logistics, how drones can increase the universal access of healthcare to the every corner of the country or the world for that matter, and how drones are able to reach where we are actually not even reaching with any mode of the transportation. What on a positive side has happened in last 2 years, the regulations has come really streamlined up to a level where literally we are able to fly in different regions. In terms of the terrain, Indian manufacturer needs to build the drone for a very versatile geography, and that's what as a manufacturer we have been doing. You need to operate in a desert of Rajasthan, you need to operate in, as ICMR spokesperson was saying, in Spiti, as well as in Nagaland when the winds are high and the altitudes are high. So if we are able to make the drones which are sustainable in all of these environments. Second thing, today, generally accepted number of landing, as you were asking in the last question, that what is the lifespan of a drone today? People are accepting around 500 landings, in defense and in all of the procurements. But as a manufacturer, we need to move to 6,000 landings and 12,000 kind of a landing mark as a lifespan to reach certain point in unit economics. So, and then right now, we should not be expecting all of the government, state governments or the buyers, be it a private, that the drone deliveries will be in comparison to the ground logistics. It will be costlier up to a certain point of time, and together we need to adopt in a certain use cases, which makes a lot of sense to use drones basically. And how we are solving the other problem basically, which is scalability, is by creating an end-to-end solution, which is just not a drone. Drone just is a one of the tool. From order management system to the fleet management system, and then the AIG and 5G enabled network of the communication also, which is very important. And our drones are fully enabled with the RF, 4G, 5G, and satellite communication, because you need to keep your drone network very secure. So thanks to Niti Aayog, World Economic Forum, and all of the states today who are present here to basically participate in this particular workshop. And work collaboratively to take this drone delivery ecosystem in India, and then we will be able to figure out all of the nuances and nitty-gritties if we will not work in silos. Thank you.
Thank you. Thank you, Vikram. Any specific problem statement that you've encountered that you feel drones have not been able to solve? I believe
in terms of the application?
In terms of application. Any examples where you feel technology maturity is still a little behind?
I think the payload, where, I mean, if let's say we need to talk about the unit economics or middle mile, we need to transport 50 kg, 100 kg and beyond. And that is yet to achieve. So that's where I think we as industry need to work on.
Perfect, thanks. Yes, please. Please introduce yourself and yeah.
Good morning. My name is Dr. Rahul Singh. I'm the founder director of an air ambulance company called ICAT. I want to touch base on a certain aspect of drone application. My industry deals with very, very high stakes. High stakes in risk to life, high stakes in money, and high stakes in the precision, the military precision which is required, especially in terms of aviation. To touch base on the application of drones in organ transfers. So I'll just throw up the challenges from the medical side so that all the stakeholders here in this room can throw light on how to solve that. Aviation is used only in two organs, that is heart and lungs. That is because these organs do not survive after a brief period of time outside the body. This period is called cold ischemic time. For heart, it is 240 minutes. That is from the time of cross clamp, that is the blood supply to the heart is cut off, to transplant into another body is 240 minutes. We waste half an hour in cooling the heart down to 4 degrees centigrade, and then we transport it. The transportation requires a road journey from the hospital to the airport, then the air logistics, and then the road journey from the airport to the hospital, and then the transplant itself. So we are looking at 210 minutes for a heart transplant. And this requires an aviation application only if the distance from a hospital to another hospital is more than 150 kilometers. So if we want a drone solution for this, we need a drone to have a payload of 50 kilograms, and also to be fast enough to reach the hospital in 210 minutes and less than 200 minutes, because you need the time to transplant as well. And from the air ambulance point of view, we do more than 90% of all the organ airlifts in India. All the majority of these organs go to Chennai, Hyderabad, and now Bangalore is coming up in a big way. And they come from all over India, especially the heart and lungs. So the aviation is essential. We don't use a turboprop if the distance is more than 400 kilometers. We use twin-engine jets. And there's always a backup. There's a backup aircraft because the receiving point, the chest is open and the organ is out for the receiving patient. So there are two lives at stake here. One is the donor who's already gone, and the one is the recipient whose chest is open. So he's on a point of no return. So there's absolutely no margin for error. Whether you use a drone or a helicopter or a twin-engine jet, there has to be a backup. So the drone needs to be covering that amount of distance with that speed and without any foolproof. I mean, it has to be foolproof. The other application of drone is also on the surveillance of the national highways. We were working very closely with NHAI, and they were creating drones for surveillance on 50 kilometers on either side of the toll booth. This highlights an incident happening on the national highways, which is most essential because the patient selection and the call criteria becomes immediate and prompt if there's a drone surveillance in that area. So I just wanted to highlight these points.
Thanks. One thing that we don't measure is the pressure that a green corridor on road puts on, say, the traffic and the local police, right?
Yeah.
So definitely an alternative that can be mainstreamed.
True.
I believe we have Dr. Sharad from iSpirit who would like to speak a few words.
First, Anna, thank you for inviting me. I'm happy to be here. I represent iSpirit, which is a non-profit volunteer technology think tank. Some of you know us from our work on India Stack. We're the one who brought India Stack to life, which is really flow of people, which is Aadhaar, and now MOSIP. MOSIP is the one that is traveling outside India. Flow of money, which is UPI, and now flow of personal information, which is the account aggregator system. Niti Aayog, which is based on a protocol called DEPA, and Niti Aayog has been instrumental in getting that out. And the new law that you see is to take it from the financial sector to all other sectors. So next year, our focus is on something called WANI, and I'm not going to cover that here, which is Wireless Access Network Interface. And we're going to be coming to you to discuss what we think should happen on drones. Our perspective is a little different from what you heard today, but complementary. I think one of the most important things that will happen is if government becomes a market maker for drone services, that is when the market will truly take off, because government is usually the biggest buyer. But we could end up having a very vibrant services industry in India, but no drone industry in India. Right? This has actually been the bane of our situation in telecom. We have the world's best operators, but no telecom equipment industry. In garments, we are winning market share from China, but the fact is 82% of the new industrial sewing machines that we are buying are Chinese. Not far from here, we do 80% or more of diamond cutting, but almost 100% of the diamond cutting machines are foreign, right? So our job, I think, as a policymaker has to be that we see both the services layer come up, but also the drone industry to come up. And that the learning from the other three areas has been that requires a techno-legal approach to policy making, and that requires public policy and public technology to come together to actually, in this case, bring BV laws to life in a way that is unique to India and will also travel to other parts of the world, right? Because it's only when we set a standard that is applicable to India, which is also relevant to other parts of the world, will our companies actually get global scale as we go. So I think hopefully in this coming year, we'll see some of that discussion happening where we can actually look at BV laws in a brand new way, and make sure that we have public technology for legitimate use. What does that mean? Remote IDs and security switches. We have public technology for flight planning, because that's going to be enormously important. There is work that is happening on Navic Max and anonymized flight sharing. So you don't need that in Arunachal and Meghalaya because there's not much traffic, but if you do that around Bangalore, that will be definitely an issue. We need open source AUTs if we got to get Indian industry. We got to have open source geocaching, because if you're going to rely on foreign suppliers for this, we'll never get scale. And traffic management has to be fully automated. It will be in the hands of the government, but it has to be a non-repudiable, completely automated system. Dynamic pricing will be important. And we need to introduce some system so that equity is maintained and we don't have monopolies that come up. Otherwise, we will see what's happening in the US, where Amazon and Google are dominating the drone industry, and they're not going to leave any space for small companies to survive. And that's the risk that we have here in India as well. So I think next year hopefully will be a vibrant year for these kind of techno-legal, public policy, public technology discussions, so that the new generation of BV laws policy can be brought to life. Looking forward to those discussions as we go forward.
Yes, please. Shri Kishore Babu from DOT.
Thank you very much. Myself, Kishore Babu. I look after the division called Standards, R&D Innovation from Department of Telecom. We have got our member Technology Digital Communication Commission. He's also here with us. So we want to, inform to the drone industry members who are here. Like we also heard about the availability and accuracy of position, and also spectrum bands for the next generation drones. Department of Telecom has started work on identifying spectrum bands for BV loss kind of applications, number one. Number two, the standardization of key non-payload communication sectors, like for example, including 4G, 5G, as well as satellite links. The way you mentioned about, the criticality and highest percentage of availability for delivery end to end. So for these activities, one is about identifying bands, and second one is about identifying the standardization, because it's having multiple interfaces. We see a huge opportunity for India, especially with startups as well as SMEs who are working on drone, because we have visited our not only the Pune area, but also the Maker Village, which is having fantastic companies who are working on drones. So we invite you to be in touch with us on these two parts. You are welcome to be part of the engagement, and we are also driving something called Telecom Startup Mission, especially to drive your work and to support you with these objectives. Thank you very much.
Thank you so much. So in the interest of time, I'll just briefly put out the points that we discussed. We spoke about the infrastructure, the soft infrastructure and the hard infrastructure around drones. The need for a revisiting of how we view BV loss, the BV loss flights. Point to note is also the economics, because any hardware ramifications will directly translate to the customer. So those things that we need to look at, and the urgent need for a catalytic funding to scale from pilots to into the middleware and to full-scale demonstration. So on that note, I would like to invite Shri Rajiv Bansal, our Civil Aviation Secretary, to share his viewpoints and give us his vision for the way forward. Thank you, sir.
Thank you, and good afternoon. My colleagues from Niti Aayog, World Economic Forum, several senior officials from Department of Telecom, state officials, and friends from the startup industry, the drone manufacturing industry, and all the distinguished guests and invitees who are here today. Pleasure to be here today. And let me start by saying that I'm Rajiv Bansal, Secretary of Civil Aviation. Every time I come to such a meeting or discuss some of these issues, the most amazing thing I find is the way or the position where India is situated in today. Just last evening, the last meeting I did in my ministry before coming here was, we were talking about operationalizing the 4th runway in Delhi so that 4 runways can simultaneously work in Delhi. Once they do that, and that's going to happen perhaps by September next year, which is about 9-10 months away, we hope to become the largest airport in the world. The largest airport today is Atlanta, which carries about 108 million passengers. We should have the capacity to reach about 110 million passengers by next year. So that is one end of the spectrum that civil aviation handles. And the other end, it's so fascinating to see these movie clips from the Northeast, where we are talking about heliports, drone ports, vertiports, call them what you like, which we are talking about. Infrastructure, very micro infrastructure where we can enable drones to take off, land, and have a system of communication where on a real time you're communicating, ensuring that there's a technology which DOT provides so that there's no breakdown in the communication, and we ensure both safety and speed. I think safety and speed are 2 cornerstones of civil aviation. And if you see, this phase that we are in, I sometimes feel it's like what civil aviation was 60 years back. That's when, of course, the Wright brothers invented the machine much earlier. But over the last 60 years, we've seen growth of civil aviation. The largest aircraft, and it's such a joy. Each time you see an aircraft like a 777, you just see it and you're awestruck by the scale and size of it, the entire wingspan of it. And to imagine how these 2 engines will be able to take off such a huge payload into the sky and keep it in the sky for 18 hours. It's such a sight. It's such a sight. And somebody talked about sustainability and carbon footprint. Now, what is Boeing doing, to try and increase the sustainability? They're trying to increase the wingspans. And the next generation of 777s will probably have longer wingspans, and since they can't come into an airport, they will fold up, the wingspans, the wings will fold up. So that's one end of innovation happening. And the other end of innovation at a very micro level is the drones. Each time you see a drone itself is such a joy. And it's something which is still an emerging technology. I mean, I must confess my ignorance, or my, even though I've been in this sector, it's only till last year that for the first time I could actually see a drone flying. And I don't know how many of you would have actually seen a drone flying much earlier than that. So it's very, very current, and this industry is very, very nascent. Some people talked about what's happening globally, and the Googles and the Amazons of the world. We're not far behind at all. We are at the global level in this technology, and that is why one of these areas we often talk of is, let's try to be at the level at which the world is. And there's this whole concept of Atmanirbhar Bharat, and people talked about whether it's being manufactured in India. You would know that the regulations which came in, put a restriction on import of drones. There were a very large number of Chinese drones which were flying in our skies. And the Directorate General of Foreign Trade, by a notification, put a restriction on import of drones. So most of the drones today are actually getting manufactured in India. Components are not, but that ecosystem is also growing. Having said that, what's happening in the last, I would say so much has happened in the last about a year and a half. The drone rules are not very old, they're very recent. The drone rules got published, the digital sky map became a reality. The regulations for where you can fly, which altitude you can fly, the red zones, the green zones, the amber zones, all that got published. We had a drone festival in Delhi, in the Pragati Maidan in May, I think. We were surprised, 75 startups registered and were present that day for those 2-3 days in that function, which was inaugurated by Honorable Prime Minister. We started, so these startups came up, but the drones that they're making are yet to be certified because there are huge safety issues. These are flying objects and unmanned flying objects. So there's obviously a huge safety aspect to all this. So the certification process was put in place, and there was somebody who was speaking from QCI perhaps as soon as I entered, and he was explaining the certification process. So all these 75 companies are manufacturing drones in India, out of which I think about 13 have created a product which they have applied to the certification agencies for certification. As of now, 5 companies have got their drones certified. And there are 8 in the pipeline. On an average, I've seen in the last 5 months, 1 company is getting 1 drone certified every month. And hopefully this will increase. There are 8 in the pipeline. And each of these 75 companies, hopefully not in 75 months, but in the next 10, 12 months, should be able to get their drone certified. There's learning of each company is also learning from the others. And that is why now increasingly I'm seeing that the certification is happening faster. Okay, so now you had the drones, but you had no persons to fly the drones. And then the RPTOs, the remote pilot training organizations, started coming into being. So there were regulations which had to be created for those remote pilot training organizations. They were created. And now, I think about 40 RPTOs are already there. About 2,000 pilot, certificates have been issued. They are issued online. But that's not enough. For the kind of applications that we are looking at, obviously 2,000 is just a drop in the ocean. But these 40 training institutes that I get a feeling that these training institutions will go up to 100 in the next couple of months. And the number of pilots which would be available should be about 10,000 in a couple of months from now. That's the numbers that would be available. Now with that, I'm not sure whether that figure that one of the young ladies said about drones being 25 lakhs is a correct figure. My understanding is that they're in the range of about 8 to 10 lakhs. But as the number of manufacturers grow, the scales kick in, the prices will obviously come down. After all, these mobiles were also at one point of time 50,000 rupees. And a good, a reasonably good mobile today with all these features is not more than 10,000 rupees today. So these prices will surely come down. I think the next phase which is happening is about drones as a service. This is a space which is evolving. The most kind of widespread use of drone as a service has been in the field of agriculture, where we are using drones for spraying both fertilizers as well as insecticides. How will farmers actually be able to procure this drone as a service for spraying fertilizers or insecticides? That is something which is happening all over the country. Sometimes I talk to drone companies, they say that this service is available for 400 rupees an acre. You can take a drone who will spray fertilizers on your crop for about 400 rupees an acre, which is not high at all, but probably a better price point is something like 300 rupees an acre. But this is happening. This is happening. Really happy to see the applications in the medical field. The northeastern states, Meghalaya, Arunachal, somebody spoke of Nagaland also. I belong to the Nagaland cadre. I have lived there 15 years. One has kind of, over the life, seen how difficult it is to transport over hilly areas, and particularly during long monsoon period where the roads get eroded and washed away by the rains. So obviously there is a huge potential for application in these hilly areas. The entire northeast, J&K, not only the hilly areas, also the island territories. There's a huge potential for application in the island territories too. A lot of pilot scale applications have happened, but pilot to scale is the journey that we now need to transcend and cover. Obviously, somebody talked about government as a market maker. Yes, obviously government has to be a market maker. Government can provide what? Government can give you, the state health departments. Health is a state subject. The health departments, from Meghalaya, the gentleman who came here mentioned he's part of the health mission itself. The health missions can integrate it in as part of their delivery programs. One of the participants talked about various missions that the health departments have for tuberculosis, for malaria. How can the health departments integrate it and make this as a part of their programs? That is where this entire application of drones for medicine delivery will get a lot of tailwind and will be able to move forward. The Ministry of Agriculture provides a huge subsidy, up to 10 lakh rupees is being provided through the Krishi Vigyan Kendras. This is something which is really not known, and we have been working with Ministry of Agriculture to create awareness so that there is offtake of this subsidy. My own ministry provides support by way of a production-linked incentive scheme, both for components as well as drone manufacturers. Happy to inform that 23 companies have, in the current year, been selected or enlisted for providing this PLI, production-linked incentive scheme. We should be able to provide it within this financial year, within the next 3 months. And, we had budgeted a small amount of 16 crores for this, but the response we got was so much that this fund, that allocation that we have for this year was inadequate, and the finance ministry has been good enough to give us additional fund allocation for this year. So that's the kind of enthusiasm and interest that we are seeing both in drone manufacturers as well as component manufacturers. Dr. Singh talked about movement of organs. In fact, in our country, it's, as I was saying initially, it's very exciting times. We are moving on all fronts. We don't have something called, what is popularly in Western countries, they have a helicopter emergency management, a helicopter emergency medical service. We don't have that. For the first time with AIIMS Rishikesh, we have brought out an RFP where, with government funding, we will provide a helicopter on demand for medical evacuation, for accidents, for any kind of medical service. And we've tied up with AIIMS Rishikesh. There will be paramedics and medics available, and those helicopters will be stationed there. And we're launching this as a pilot project for 1 year. The RFP was, the technical evaluation, in fact, was done yesterday. We'll be opening the prize bids. So this will set the set the path forward for a new way of medical rescue with helicopters, something that has not been tried and tested in India. Maybe once this is successful, then this model will get replicated on all our highways, on all the highways that we are making. Each day, nowadays, we are reading about news reports where accidents have occurred on the highways due to fog, particularly in North India. So, do we have a system by which we can provide medical relief for these accident cases and provide that within that golden hour that you were talking of? Some of the challenges ahead. One of the biggest challenges ahead, which is something that the whole world is facing, is how do you have a unified air traffic management? Do we have that air traffic management? How are we going to operate all these drones once they come into existence? There are manned vehicles in the sky, there are unmanned vehicles. And these unmanned vehicles are not going to be like we have 700 civilian aircraft. These are not going to be 700. These will be 7 lakh or maybe 7 million soon. So how do we integrate the space to ensure that there is a unified air traffic management? So there's still a lot of work which remains to be done on this aspect, and nobody has globally the experience, the technology, or the solutions to be able to manage this in a safe and effective manner. Nano fertilizers is one thing which is also now gaining ground, because application of conventional fertilizers was one thing, but now nano fertilizers is a whole new concept, and this fits in well with the concept of drones as a service for agriculture. I would say our technology is stabilizing, it's still developing, the payloads are increasing. Often some of these payloads that we were looking at are small payloads, maybe 2 kilos, 2.5 kilos. The challenge is to move this 2.5 kilos payload to 25 kilos or 50 kilos, 100 kilos. It's been done on a pilot scale in many places, but those drones are yet not certified. Parallelly, you would be reading, there are several countries I've seen in France, in Norway, where they have these vertiports for, also United States, for unmanned vehicles, but for carrying men and women, for carrying passengers, human beings. So the payload there is something like 250 kilos. But none of these devices globally are yet certified by the FAA, the Federation of Aviation in US, or the EASA, the European Safety Regulator. No device is the eVTOLs, the electric vertical takeoff landing devices, as we call them, as so far are certified globally. But the distance between a drone which is carrying a medicine of 2.5 kilos payload to a VTOL, a vertical takeoff landing device, which is carrying 250 kilos, is again the entire range. There's work happening. There's work happening globally. And I would feel that in the next 2, 3, 4 years, and this was a question that was asked to me in one of the Niti Aayog meetings, by when would this become a reality? I would feel by 25 we should see the first vertical takeoff landing devices getting certified by the FAA or by the EASA, and this concept coming into reality. In our own country, IIT Madras is working very actively on this, and this is one area where again we are trying to keep pace with the developments of what is happening globally. We in the government are, and people talk often about silos, we in the government, across the government, not about civil aviation at all, but about civil aviation, agriculture, health, we are more than keen, more than happy to support drones, to support programs for applications in the health sector. For applications in the health sector. They will have to be integrated with the state health programs. And as I said earlier, health is a state subject. And health delivery, primarily, and all the PHCs that the doctor was talking about, the primary health centers, is managed by the district health officials. So we need to integrate our proposals, our schemes with the state health delivery programs, and whether any funding is required from the government or support is required from the government, I think there is no lack of commitment or intent from the Government of India's side. You have our fullest assurance, cooperation, and support. Some of the young drone manufacturers who were speaking, I've had the pleasure of visiting their units. I would strongly encourage all of you who are there in this system to visit a unit. There is a huge learning. There's a huge learning to see how some of our bright engineers are actually working on these prototypes to see, and they're creating these with their own hands, and these are things which are happening. It's not like, it's not like reverse engineering which is happening where we bought some product and then they are trying to reverse engineer. I've seen some of these units. They're actually developing right from scratch, and it's really a very proud moment to go to some of these manufacturing units. We are happy again, let me reiterate, we are more than happy to support it in every possible way. There is still a lot of gaps in technology on how would so many drones operating in an environment, how do we ensure that they stick on path, they don't hit each other, they don't cause damage, they don't drop the payloads, they don't interfere with manned vehicles, they don't go off track. And of course, last but not least, I don't wish to dwell on that, is about rogue drones. How do we ensure that what is a drone and not a rogue drone? So there's a lot of discussion happening on all these fronts, on the policy front, on the regulation front, on the security front, on the incentive front. Multiple fronts are open on which work is happening, but I can only assure you that we are more than open to receive your suggestions. A workshop like this helps us learn from you. All of you learn from each other as to what is happening, I'm sure Madhya Pradesh can go back and see how the northeastern states are implementing it in the medical field. Really, it's such a proud moment personally for me to see how northeastern states have taken the lead in this area, and in fact the other states they're becoming a role model for the other states to follow. That's all I have to say. I'm happy to take some questions if you have. Incidentally, since somebody talked about unit economics, in an aircraft, in a civilian aircraft, when we move good from A to B within the country, it costs about 10 to 12 rupees a kilo within the country. So I'm just kind of averaging out a Delhi to Bombay or a Delhi to Chennai. It costs about 10 rupees. That's the unit economics in an aircraft. Yeah, happy to take some questions.
So,
yes, doctor.
Yeah. So I would like to first congratulate you on the introduction of HEMS, Helicopter Emergency Medical Service, for the first time in India. Sri R.N. Chobe sir was our mentor when I had come back from UK with 14 years of HEMS experience in UK, sir. And I would really like to congratulate yourself and the Honorable Minister of Civil Aviation, Sindhya ji, for introducing HEMS. I mean, in context, out of the G20, 19 of the G20 countries have HEMS. We were the only ones which did not have, and you clearly, put in your vision into this. India definitely needs 130 helicopters, to cover each and every part of India for emergency healthcare. Thank you very much, sir.
Thank you. Yeah, so helicopter penetration in India is very low. We just have about 225 helicopters versus a Brazil with 5,000. I don't even know what is the number in US. But yeah, penetration is very low. Affordability is an issue. Building it into a insurance scheme is an issue. We talked to the insurance companies. We couldn't find that success. But as then somebody said, government has to be a market maker. So we are making that market. We are making that market. So the first year, OPEX, we are underwriting entirely. Yeah, any other points?
So
yeah.
I'm Sanjeev Malhotra. I represent MITI NASCOM Center of Excellence on Emerging Technologies.
I know you.
Congratulations for the wonderful work.
I worked in MITI, that's why I know him.
Yes, we used to work together there. Thank you. We work closely with a lot of startups. A lot of these young startups, are part of our program. And also we work a lot with the industry and some of the programs. And some of the use cases now that have started coming from the industry is they want to use drones for transporting things, where they want to cut down time for manufacturing and some of the crucial parts. Do you envisage a scenario where we can use drones for these purposes even in larger cities? Or do you think there is still some work to be done before we do that?
Yeah, I think two things I'll say. One is for a country of our size, geography, population, let's say 10 years, let's fast forward 10 years, I think the maximum drone penetration will be in a country like ours. But the use case that you're talking of for transporting pizzas and transporting bread and eggs, perhaps is not the best for us. Perhaps. I'm not saying that we should deny the door delivery companies to use drones for this. But there are a million other use cases which to my mind will do much better in India. The other day, we were looking at how do you transport, these fishermen go out at night to collect fish, and sometimes they're there the whole night. Can you move the fish from their boats into land very quickly so that by the first hour in the morning, when the village market is there, the fish is already come in? I'm just giving you a different way of moving goods, but not moving pizzas, but moving this. So, but I think the market dynamics will ensure that whatever can flourish in the unit economics that she was talking of will work. But in cities in urban areas where there are buildings, high-rise, low-rise, the biggest challenge is going to be about air traffic management and ensuring that there's no collision. And again, somebody spoke about, obviously this will have to be automated. It can't be like, aircraft in airports, we have a manual ATC which gives commands and allows permissions. This here we are going to talk of hundreds and thousands of drones flying in a city. So they will have to work on an automated system. They have to follow a path which is pre-fed. And what happens if they deviate? That is still work in progress. I mean, nobody has answers. But even in the US, we don't see any city or in Europe where there are multiple drones whizzing past you open your window and you see 100 drones. It's not happening yet. So those are the challenges. I think the easier bit is applications in agriculture, in areas where the chance of collisions is much reduced. That's the easier bit.
Right. Thank you.
HEMS, Doctor, we did this RFP. I did a meeting with all the helicopter players in India, but nobody bid. Really difficult. We've got just 3 bids, and we're a government system, so we need those 3 bids. I'm really hoping that the next week when we open the price bid, it takes off. Otherwise, again, we'll be, unsuccessful. That'll, set back the whole program.
Sir,
but let's see. Let's hope we succeed.
Sir, this is regarding the operational issue. As you are from Nagaland cadre, you must be aware of Mokokchung Twinsang. So we had a flight between Mokokchung to Twinsang, but when we reached to Twinsang, there was a problem in operational difficulties, like coordination with there are different types of armed forces, and we have to coordinate each of them separately. So is there any mechanism is coming, or what would be the best mechanism? Because we have to inform them, like Assam Rifles are there, the local police are there, other reserve force are there. So we have to contact them individually. If we are missing one, then we are in trouble. So now we are going to like Spiti and Lahore. So what could be the best mechanism, or is there any mechanism come up with where we can coordinate with all them together? Thank you, sir.
Yeah, so we will have to put in place a system where the security forces combine their efforts together, whether it is at the police, in the state there's the police, then there's a central paramilitary, could be a CRPF, and then there's an Assam Rifles, and there could be a core army regiment. So we will need to put that in place. There isn't something as of now, but wherever you are facing these challenges, bring it to our notice. We'll start putting in place this thing. Mokokchung is a place in Nagaland. Very few people even know that name. Yeah. I've served this. Yeah, I'm familiar. Yeah, yes, please.
So I'll give an anecdote. I think what you said is important. We have to have this mindset that we can lead this industry. And you said, we'll have 7 million drones, not 700, planes that are flying today. So the crash avoidance policy of FAA, believe it or not, is no longer written in English. It's written in code. And that code is on a language that originated in Bangalore called the Julia language. So it is, we sometimes we don't even know the influence that we are creating, with local technology. It's an open source language to do with scientific modeling. It's now one of the most successful languages in the scientific modeling world, which has come from Bangalore, 2 co-founders from Bangalore and 2 from MIT who came in later. So there is an opportunity for us to open our mind and think of this in a way that the West is not necessarily looking at it. And that would give us the chance to move forward. And this is really what we were able to do in some of the other areas. We should definitely examine this for drones as well. So
I agree with you wholeheartedly. I think envisioning the future is the biggest challenge. And if we can do that, half the race is won. So Prime Minister has asked us to make some visioning for 2047, which is not too far, but it's 100 years of independence. and we presented a document, and we talked about hyperloops, and we talked about eVTOLs, and we talked about several emerging technologies. We also talked about maybe these airports we are building is not required. Maybe augmented reality, work from home, work from anywhere will change the way people will travel or commute. So is it a good idea even to make all these offices, we were looking at all those technologies and how they will impact society, living, commuting, business as a whole. And so a lot of people in the audience found it very, very futuristic. But these are things that's going to happen. I mean, augmented reality, it's not a word, it will keep improving. The augmented bit will keep improving as we go forward. So it's interesting times because technology is changing as per Moore's law. So we don't know how fast it will change. You guys know better. Sorry, yeah.
Sir, one more question.
You're a doctor, is it?
No, sir. I'm from 13 batch IAS, sir.
Okay.
I'm not a doctor. My question is on this red zone, sir, particularly for Meghalaya context. What we're trying to do is there's a lot of red zone because we share a large border with, long border with Bangladesh.
Bangladesh.
Yeah, and the question I think someone had already raised in the first, I think Mr. Vignesh made a presentation. How do we actually get some exemption for these health facilities? Particularly the most needy are the ones who are there in that locality. Is there a quick clearance which we can take it so that we can actually make it much faster?
At a foreign policy level, I've been suggesting let's give a few drones to Bangladesh. They'll also understand the potential of it, so that you get a buy-in that because this technology, I'm telling you, drones is not, people don't know about it itself. I mean, we don't know about how many of us had actually seen a drone earlier than 2 years from now. So, but it's a complex thing. I mean, it depends on how friendly our nations are, neighbors are, and these things work on reciprocity. So,
and that's why I'm asking in particular Meghalaya context, since it's Bangladesh. I mean, we seem to be, at least in that area and state, we have a much better relationship on the ground because we have border hearts. We have these things are already happening on the ground. So even at least in the yellow zones also, if it can be there, because quite a few of our areas are there.
Good idea. We'll work with BSF as well as with the Defense Ministry on this. We can work with them.
Okay,
sir. It's not something that I can do. I mean, these are aspects that Ministry of Defense comes in, but we can make a pitch for it. That's the point I'm only saying. I can't assure you either way. I think we've run out of questions as well as time.
One more last thing. But when are these heavy drones are expected to get any clearance?
Sorry?
That the drones with heavy payloads, the 25 kg ones at least, are we expected to get any clearance for them, sir?
No, it's not when are we expected. The drone manufacturers have to make it. Then it goes through a certification process. That itself, it's supposed to take 60 days, but then there is a lot of back and forth on that. And once the 3 certification agencies approve it, then it comes to DGCA. And it takes a month or so in DGCA. So I don't know, you'll have to, the drones, the 8 drones which are in the pipeline, offhand, I don't know what is their payload capacity. But some of these, I mean, I think Tech Eagle is there, you'll be knowing.
They are working.
Sorry?
25 kg.
Up. You can answer, I think, that question.
So, sir, I think we are waiting for the BVLS certifying standards. So, I think it is waiting from MOCA and DGCA side. Once it is out, we will start filing for the TC approvals for BVLS drones. Specifically to the sir's questions about the 25 kgs one. So, as a Tech Eagle, yeah, we are already working on it. But even not even a single drone yet certified because there is no standard for BVLS so far. So first I think we need to start certifying the existing ones, the smaller payloads, get a learning from that, and within 6 months we'll be ready from our side as a equipment. But then the certifying bodies and the standard needs to be in place.
I think the answer is maybe 6 months to a year. This is something which will happen in another 6 months to a year.
Sir, if you can just highlight that by when you are also expecting, or we can also expect the BVLS standards to be, I mean, out. It is already in the process, but if you can just highlight that by when BVLS standards will be out for TC.
I don't have that answer just now. I don't want to give you an answer which I don't have. So I'll check with DGC and then I'll revert that to you.
Thank you, sir.
Okay, thank you. Should we
Thank you very much, sir, for your insights, for addressing the concerns of all the stakeholders so patiently, and charting the flight ahead for scaling up drones ecosystem for healthcare in India. I thank all the participants and stakeholders also for your valuable inputs now and making the session a very productive one. Now, I would like to cordially invite you all to proceed for networking lunch, after which we will assemble for a session on leveraging 5G technology for healthcare. Thank you so much. We'll assemble at 2 p.m. 2:30 p.m. would do, because it's already late.
Hello. जी sir.
start now. Okay. Good afternoon, everyone. I am Dr. Ruma Bhargav. I lead the health vertical at the World Economic Forum, and I welcome you all to the second part of our workshop today. The second session of today's workshop will be focusing on leveraging 5G technologies in the domain of public health. To kick off the session and deliver a keynote address, I would like to invite on stage Mr. Sanjeev Agarwal. He leads the critical technology vertical of Department of Telecommunication. Sir, please.
Thank you, madam. Good afternoon, everyone. Vice Chairman, Honorable Berry-ji, Member Health, Honorable Paul sir, and distinguished stakeholders, ladies and gentlemen. First of all, I would like to appreciate the effort of Niti Aayog and the World Economic Forum for holding this workshop. It is very timely workshop and very important to have this kind of deliberations so that we can take all the use cases of 5G forward, and specific to health sector, we'll be discussing more on that. And these efforts will certainly sensitize all other sectors also in adopting 5G technologies. So I'll take you through a very small presentation. We have launched 5G very recently. We are working on 4G. 4G is almost deployed in 98% of the population. 5G, we have launched, Honorable PM has launched it on 1st of October this year. And subsequently, our telecom service providers have started rolling it out. So the pace of rolling out is also very nice, and they have covered a lot number of cities. And by the end of December 2023, expected to launch Pan-India. So we are here to see how we can leverage this new technology, emerging technology, for the benefit of the last mile person, for the last citizen of the country. Maybe it is from the deep rural or maybe in the city. Everyone should get all the facilities which are available to any citizen of India. So that is the primary aim. If you see 4G, there is some gap. We have not been able to provide to all the villages. For that, Department of Telecom has taken up, and we are now gone for a 4G saturation project where all the 26,000 villages which were not covered will be covered by 4G, and some of the villages where only 2G or 3G was there, that is also going to be upgraded to 4G. So by that, 4G will be available all across everywhere in the country, including all the villages which are not covered. So if we see the different verticals, there are many use cases here. And specific to health sector, we have taken this data from rural health statistics. It is a little old data, but the fact remains that there are certain gaps in the health infrastructure where, as per the old data, 46,000 sub-centers and 9,000 public health, primary health centers, and about 3,000 community health centers were not covered. So for coverage of these, there are innovative solutions which our startups have given, and our TSPs have also incorporated some of them. So we'll be discussing on all those things. So if we look into the features of 5G, the features are extreme mobile broadband. It's basically very high bandwidth broadband, and use of massive scale communication, that is machine-to-machine communication. It's a very high scale machine-to-machine communication, which is the requirement as of now for deployment of IoT devices. And another feature is ultra reliable low latency. So this low latency is the requirement mainly which will be required for robotics kind of thing, robotic surgeries and things like that. Even for the vehicle-to-vehicle communication. Very low latency required and ultra high reliability also. This reliability feature is a 999 kind of thing, which is very high. You can see like it's about 5 minutes in a year downtime. That kind of reliability will be available through these kind of deployments. So there are multiple use cases which we have mentioned here. They are human to human, human to machine, and machine to machine also. For health sector, there are examples of golden hour and unserved rural areas where we have discussed. We are aware of all these issues. And in the morning session also, we have discussed about the drone supplying the medicines and other critical items to the remote and rural areas which are not easily approachable. So one of the thing I was thinking, like medicines have reached, but not the doctor, the specialist have not reached. So how to reach the specialist? Specialist is available at city level or the district level, and this village is not having that kind of expertise. So the solution which is provided by one of the startups, this is giving one small ambulance kind of thing, which is mounted on a very small tri-wheeler, three-wheeler kind of thing, which is having all the facilities which is required in the case of medical emergency. So any paramedic who is a little bit trained can use this and be there at the remote areas, and this van can be connected on 4G or 5G to the district where the expertise is available. So even the remotest place will be able to get these kind of services through the deployment. Another is a small kiosk kind of thing where the blood sample can be taken and put into this machine. This machine is connected over telecom network to the main center where the diagnostic can take place and results can be analyzed and immediate treatment can be given. The medicines have reached that primary health center, and this reports is analyzed by the specialist at district level. Though probably that medicine administration can be done at a very fast pace. That is the idea. Then there is one wearable jacket where the sensors are there. This can be carried by our ASHA worker to the remote place, and they can wear this jacket. The patient can wear it, and the statistics of his health can be transmitted to the main center where it can be diagnosed and treatment can be given. There is one another example of doing a ultrasound kind of thing by a very, I should say, very little trained technician. So he can put that device, and the diagnostic can be done by the doctor specialist sitting at a remote place. The drone based, we have already discussed much about that. So there are multiple use cases, and this was also discussed in the morning. Dr. Paul said about this VR, AR based education classrooms, where this three-dimensional pictures of any organ and anatomy, that is making the things very clear to the students, and that can be used in an extensive way. So how we are providing the connectivity is basically through fiber connectivity, 4G broadband, 4G, 5G fixed wireless, and radio or VSAT based Wi-Fi. So these are the connectivity. What we need is a lab. Basically, we want that a lab should be set up somewhere in near the hospital or the medical college, where the experts are available, where the trained technicians are available, and any of our startups who is developing any of the product related to medicine can go there and try test their product. So that kind of infrastructure we need to create so that we can harden the outcomes. We can directly measure what, as a morning also Dr. Paul said, so it should be majorly outcome based. Whatever we do, we should have the outcome, and ultimate objective should be reached. So that can be focused by this kind of lab deployment, and then the standardization and integration into the health schemes. From DOT side, we are funding the test beds. We are also giving funds for R&D. We have established a number of committees, interministerial committees, having discussion regarding 5G with all the ministries, and one by one we are giving them our inputs so that they can deploy and start with their labs, so that all these use cases of 5G can be exploited. 4G, we were very much advanced there, but we didn't go for use case kind of thing. So use case was not focused that time, but this time we want that all the use cases should be focused, and deployment of those use cases for the benefit of the public should be there. So we have a vertical engagement partnership program, and we have also launched bharatdigicom.in portal, where this display is like this, where all the 5G innovation are available at one place. So anyone can visit it and see what is available, and they can also get connected for further development and innovation. So what is the way forward is to set up the use case lab, the center of excellence in the health ministries and their academic institutions. That should be done on priority. DOT will facilitate engagement with industry and knowledge partnership. The pilot use cases harden and solution in real environment in a time-bound manner, and set up health use cases field test zone. We need a test zone because it's not in the room environment. Many things may not be able to be tested. So a field zone may be created. For that, we can have further discussion on this, and we'll try to give as much knowledge as possible for creating this kind of zone for connected ambulance, drone trials, and all these things. Adoption of use cases through integration into central and state schemes. States are very important entities in our deployments. We need their support, and we have seen in the morning about how the Northeast is doing all those things with drone. So that is a very nice step they have taken up, and it has been appreciated by Secretary Aviation also, and it is definitely a great step they are doing. So that can be replicated by other ministries, other departments, depending on their requirements, and we can help them out. We have already circulated a number of cases to even NITI, where we need now that pilot opportunities should be given to these startups so that they can take it further. And it's not only IP generation kind of thing, but it is actual product which can be utilized for the benefit of the public. So let us make the best use of connectivity infrastructure, and we are there to support everyone, every startup, every R&D. We are having a funding scheme of DCIS, that is a Digital Communication Innovation Square, where we are funding the R&D. All startups can go to our DOT website and look into this scheme. There is another scheme which is funded from USO fund, which is a TTDF, Telecom Development Fund. So that can also be utilized for that. For both these schemes, the dates are open, and any startup who is in that category, they can go to the website and apply for it and take the benefit of that those scheme of funding. So thank you very much. I would congratulate the NITI Aayog and WEA once again for this organizing this workshop, and I would like that everyone should get benefit out of this workshop, and whatever is required from DOT, we are there to help. Thank you.
thank you, Mr. Agarwal, for such a prolific presentation and to let us know how words are being translated into action from the lens of the government. Next in the series, we'll have presentations on 5G applications in the public health facilities. In the series, I would like to first...
I would like to now announce that Mr. Suman Beri, Honorable Vice Chairman of Niti Aayog, is now has just joined the today's deliberation. He came a little bit early. Sir, just to give you a background, the morning session was all about drones, which is a program which we are working with Civil Aviation Ministry and WEF. And several state governments were, representatives were here, and they made their presentations, their video presentations, the slide presentation, and the way forward. Many of those are part of the CS conference, which is scheduled for next month. Besides that, we also have the regulators present, and the manufacturers as well as the startups are amidst us today in the drone ecosystem. And now Dr. Ruma from WEF is conducting this second session, which is on new technologies which have now become practicable since 5G is being rolled out. So here, since 5G is the main element of this session, we are very lucky to have a very big delegation from Department of Telecom who are enabling 5G and 5G related technologies. So Mr. Agarwal is member. Technical sir, he just delivered his opening remarks. And now I again request Dr. Ruma to take the proceedings further. Thank you, sir, for joining.
Thank you. I once again welcome you, sir. So next in the series, we have presentations on the applications of 5G technology. And to kick off this series of presentation, I'd like to call upon stage Mr. Murlidhar from Yogify. The company is into making smart mats using innovative sensors and artificial intelligence.
Good afternoon, everyone. Good afternoon to the dignitaries of Niti Aayog, DOT, and World Economic Forum. So I think post-afternoon, post-lunch session, probably not a good time for yoga, but let's see if I can yogify all of you. So we will start with the first. So I'm Muralidhar Somisetti. I'm the founder and CEO of Yogify. So actually the experience in building this product has come from my own personal life. A decade ago, I had suffered from chronic lifestyle diseases, and it warranted a surgery. Fortunately, I chose a yoga path, like alternative therapy. And from there, I became a certified trainer. And during one of the classes, when I was doing online classes, I got this strange thought. People turned off their cameras during my class, and I got this thought, how about we still monitor what is happening remotely? So that was the premise on how the idea came. But the bigger motivation for me was the non-communicable diseases, which have become like an epidemic now. And during pandemic, we also saw how those comorbidities have really, increased the risk of, coronavirus. So more importantly, I think we wanted to see how we can create a system which can enable delivering yoga sessions remotely. More than remotely, how can it be more effective? Because that is more important, because especially when it comes to lifestyle diseases, as they say, prevention is better than cure. Can we really bring some kind of a daily lifestyle change, a behavioral change, so that we can cut down, we can really prevent the lifestyle diseases to happen? So I think one of the major shifts that a pandemic has given is the evidence-based yoga or remote therapy. So that trend has really significantly improved. So I'll not dwell too much on it, but there are some holistic wellness centers in India where they do these therapy sessions. But once the patients go back to home, there's no real way to really see the compliance and monitoring how they are doing, what they're doing. So this was where we are coming, where we have three aspects in our product or solution. One is a smart yoga mat, which has advanced sensors embedded in the mat. The second is the AI element, and third is the mobile app or the television app. So this was to sum up what is this product. So we have the mat which is census enabled. It enables teachers to understand the poster analysis in real time. Even though they may not be with the student, they can understand it. And the second part is it also works with a non-intrusive and non-invasive technology. We didn't really want to create anything which is not, intrusive or invasive. The key part here is like we have recently got excellent support from Department of Science and Technology and Ministry of Ayush are also recognized. And now we are working very closely with Qualcomm on how we can take this to 5G application level. So I'll talk about the 5G application. So the main idea is to see how we can make this as a therapy kit, as part of a therapy kit, which is a mix of medical devices and non-medical devices, tracking devices. So essentially, this is what we demonstrated in Indian Mobile Congress recently that happened in Delhi. We are using Qualcomm's 5G modules, and essentially it's a small device that sits on a television. Any television need not be smart television, and it pairs automatically with the smart mat. So smart mat collects a lot of data, and also TV device that we are attaching also collects a lot of data, and using computer vision and augmented and virtual reality, what we are trying to do is, let's say you are in a live classroom. It feels like you are already with the trainer, and trainer doesn't need to see you, but they can monitor remotely who is doing what and how they are doing, and they can engage them in real time. So this is the 5G application we demonstrated at Indian Mobile Congress, which was very well received by the Ministry of Health and Family Welfare and other departments. So there are a few more roadmap items, but essentially just to focus on the mat, there are requirements around the 5G use cases for the hospital and healthcare as well. So Ayush is looking at even wellness clinics. How can this be part of wellness clinics? So the therapy can be given remotely, even to the remotest of areas of India. Because the major problem is lifestyle disease is not just only for tier 1, tier 2. Even through villages also, there is a lot of increase in the lifestyle diseases. So how can we really deliver this therapy content to the remotest of areas of India through 5G applications? So ours is proudly made in India product. Entire thing is manufactured in India. Some of the appreciations we have received in the recent times, including the visibility of Prime Minister Modi. And these are our customer base today across the globe. So that's what we have been doing, made in India for the world. So we have not stopped only for India, but also to the world. So that's it. This is our team. We are 3 co-founders, and we have a team of 20 people working on advanced artificial intelligence, IoT, AI, 5G applications. Thank you so much. Just to give an idea, this is like map. It's very easy to carry as well. Roll it.
Thank you, Mr. Muralidhar, for showing how a simple yoga mat can be used as a therapy kit. Next, I would like to invite Mr. Utkarsh Dubey, Chief Technology Officer from Airtel. He'll be showing us how Airtel is working in the area of mobile clinics, connected ambulance, and colonoscopy. Utkarsh.
So good afternoon, everyone. I'm extremely overwhelmed to get this opportunity to present to such a highly experienced and diverse minds from Niti Aayog, DOT, World Economic Forum, and startups. My mind is lit up with ideas more than what we are doing, so I'm gaining everything from what the speakers were telling, especially listening to Sri Vinod Paul on the thematic action identification or co-creation, bringing the inventor, technology, healthcare together, or Sri Purushottam Kaushik on the PPP model, while focusing especially on the adoption of the local needs. Sanjeev sir clarified it that yes, 2G, 3G, 4G was rolled out, but we never had this opportunity that 5G is rolling out, and before the rollout phase, we are discussing about the new ideas which are coming. So this is tremendous. I have never seen this. I've rolled out all these technologies, but something good is going to happen from here. Uh, I saw the presentation from Northeast. We have been delivering US of in Northeast. It is very, very difficult terrain to build in towers. Sri Ramkumar has been implementing the idea beyond POC. So this is something which is tremendous happening in that geography. For filling diesels, we take around 5 to 6 days there. So this is something good which will happen in the medical domain. Putting it forward, there was Ms. Niharika who was articulating it very, very clear on the scalability and sustainability via the unit cost. Yes, this is required for everything, not just drones. I would take few minutes and quickly sum up. Sanjeev sir has already given the ideas what is happening in the industry. 5G in specific will bring you more number of users per square kilometers. It is very fast. So it has got lower latency, higher bandwidth, and greater devices concurrency. What do I mean by device concurrency is, even this hall is filled. We can have 10, 20 such halls and everybody would be experiencing good throughputs. And that is what we meant with going forward from 4G to 5G. 5G is going to give us at least 1 million users per square kilometers. 4G, it was only 1 lakh. So this is the difference between 4G and 5G. For B2B, B2B is looking at 5G with higher operational efficiency, cost saving, which is far more important, surveillance, improved quality, workforce productivity, and faster approach. So we have been doing a lot of POC trials with the B2B. We did it with Adani in Gujarat. We did it with the coal mines in Accenture in Odisha and Bhubaneswar. Or we were doing some trials with the healthcare industry. So I will refocus myself on the healthcare B2B only. We were talking about golden hour in all these discussions. I'm not a doctor, I'm not a medical practitioner. But I have understood and learned it while discussing, dealing that yes, the first hour is very, very important. How can we save that first hour in the urban, saving lives, or take those doctors to the rural by saving their time and then improving the quality of overall rural customers or the urban customers which don't want to go to the hospital. So I am bringing the hospital then and there. Sir has already shown, this is the 5G ambulance. We have done a POC trial. It is just not a proof of concept. We have been doing this with Apollo with the help of Cisco. We have demonstrated this. So this is an ambulance. We are virtually transferring the doctors. We are having a van which is equipped with state-of-art equipments from ECG to blood test and everything. The doctors can come in the emergency situations, can help you out, gauge the patient then and there. So most of the ambulances are equipped with normal nurses which are not that good. Or the doctor, when you reach the hospital, doctor will take time to come that yes, it is an emergency, we have called the doctor, please wait. We will not let the person wait. This is a 5G enabled ambulance. The doctor would be available then and there on the call, can see the patient, we can do all the tests there. I need some help in playing the video in case somebody can come forward. So I'll just give you. It is not coming here. You can just play. Just play. Full screen.
which is the first 60 minutes following any injury or trauma or any medical emergency, is very critical in saving patient lives and reducing complications.
This smart ambulance with a state-of-the-art equipment is a glimpse into what the future of healthcare would be. With multiple high-resolution onboard cameras, advanced monitoring, diagnostic and life support equipment integrated with a remote monitoring application, all connected with super speed Airtel's 5G network. It enables real-time critical support and helps pre-hospitalization treatment in transit. Here is a demonstration of how a 5G ambulance works. As the ambulance transmits the data from the patient, the doctors in the control room get a full view of the emergency situation at hand. With multiple angles, thanks to the onboard camera, the patient monitoring application and portable PC augmented with the connectivity of 5G. The doctors are getting real-time updates that are crucial to the life of the patient. This helps the command center to provide diagnosis basis the better knowledge of the situation.
Our 5G-powered ambulances, which would help to avoid delays in transit due to traffic, roads and infrastructure. It's like we can virtually bring the patient to the emergency room and start investigations and treatment protocols while the ambulance is still in transit to the hospital. As the patients are taking longer to reach the hospital, we are trying to take the hospital and specialists to the patients.
We at Airtel strongly believe 5G has the potential to change the way we live. It will change the way we work. It will change the way our factories are manufacturing goods. It will change the way we get healthcare. And it will definitely change the way our kids get education. Because of four distinct advantages of 5G, which are super critical. One, 5G can support bandwidth roughly about 100 times than what we have today. 5G will bring the lowest latency. It can support up to 1 million devices in a square kilometer. And finally, 5G has the ability to give a private spectrum so that they can get secure, uninterrupted slice of that spectrum. This connected ambulance video you saw brings together all these four characteristics of 5G very nicely. This is a clear use case of how healthcare will change with 5G, and we are very excited to bring this to life.
In the healthcare sector, 5G will arm doctors with actionable insights to augment patient monitoring and treatment. Essentially, it will forever change the way healthcare is delivered in India. Our partnership with Apollo and Airtel, leveraging Cisco's Country Digitization Acceleration Program, is a step towards improving the performance of critical care applications leveraging 5G.
Apollo Hospitals has always been at the forefront of adopting technology to deliver quality healthcare to people. In an emergency, the quality of care provided during the golden hour, that's the initial few minutes after an emergency occurs, often decides between life and death for the patient. The best outcomes in an emergency are when care is provided at the earliest, right at the spot where the emergency occurs. With the introduction of 5G with Airtel, I'm confident that this will only enhance our ability to reach out to patients and to bring in a quality improvement which will be of tremendous help in saving lives in the future.
This state-of-the-art ambulance powered by 5G proves to be a great milestone in reimagining critical healthcare support.
Need to stop it.
Airtel, the 5G
that this will only enhance our ability to reach out to patients and to bring in.
I love Acrobat because of the convenience.
I have to shut it down.
Really great to use Adobe Acrobat to be able to get real-time feedback and comments from my creative agency.
My screen. You can go back to the presentation. Yeah. So these are the facilities available. This is a use case which Apollo is working with us. We will massify this across India, and this is what we are aiming to replicate at all other places. I'll move to the second use case, which is for rural. The Ambupod, Agarwal sir has already discussed about this. We have done this trial. This is a smaller truck which can take the doctor to the rural areas, do some 55 clinical lab tests, so you don't need to send the lab reports here and there. We can have a repository, digital repository of individual patient, and then can have the treatment then and there with this. So this is a 5G powered ambulance which is taking doctors to the rural. So the first solution was with the urban, second was with the rural. We were also talking about AI, ML. So yes, I have got a colonoscopic use case wherein we can take the input right from the hospitals, process it at my data center, and then identify, is there any vision-based learning which we can provide a real-time policy identification to the doctor and say, you are not able to identify it with the naked eye. These are 4 or 5 more which are there. It can pinpoint it there on the screen, lock it there on the screen, and you can see, okay, these are the areas where the doctors need to work. So these were the use cases I have from Airtel. So I'll just cut it short because I've taken a lot of time in the video. Thank you very much, everyone. Yeah.
Thanks, Utkarsh, for enforcing the use case as to how 5G holds the potential to be a game changer in the golden hour of emergency. Next, I would like to call Mr. Shantanu Mukherjee. He heads the growth and segments at Jio. Jio has been doing some phenomenal work in the space of community clinics for PHCs, smart ambulances, teleimaging, and remote diagnostics.
Good afternoon. Pleasure to be here. My name is Shantanu. This is Ashish. I head growth segments for Jio, including 5G. I look after 5G, and Ashish is senior product manager, and all the use cases that you're going to see here, he's actively sort of worked on those. I must sort of warn you that some of those use cases are going to essentially overlap with what Airtel showcased, but we'll try and do our best. So very quickly, again, honored to be here. Thank you for putting this together and inviting us to participate. You know, Jio is India's #1 digital services company, right? And we are now striving to enable India to become amongst the top 10 globally in broadband adoption. That is our ambition, right? So we made a significant change as far as 4G is concerned, and now with 5G, this is what we are striving to do. And with true 5G, right? So effectively, what we say is that this is a true 5G network because it has zero dependency as far as 4G is concerned. It's a standalone network. It has the largest and the best mix of spectrum and carrier aggregation, and that has its impact in terms of the use cases, including healthcare in terms of how it gets delivered. And our ambition is to cover every town, taluk, and tehsil of India by December 2023. So that all of the use cases that we are speaking about here, okay, we will be able to take it to all of across the geography of India by that time. So now let's reimagine healthcare, right? So we are going to present 3 use cases here. One is we'll start with community clinic. Connected ambulance, you've already seen, so we'll quickly go over that. And we will show you something which is tele-ultrasound. Right? So let's start with community clinic. So what are we doing? We are bridging physical barriers between experts and patients, right? Through what we call as true 5G enabled community clinics. So very quickly, let's look at the video.
Despite of technological advancements in healthcare, access to it continues to remain a challenge, even in certain urban pockets. Community clinics are a great way to solving this pertinent issue. Geo-True 5G can facilitate the setting up of the most efficient community clinics in a rapid manner. First, a Geo-True 5G connection comes with an indoor CP that ensures that connectivity is provided at the clinic at the fastest speed. It also comes with a tele-ICU kit with all the necessary diagnostic equipment, which ensures that the clinic can provide timely and advanced care to patients in need. And not just that, a clinic management platform is also provided, which enables effective maintenance of appointments, patient records, and other procedural data, which are a necessity for an efficiently run healthcare center. Geo-True 5G thus provides a comprehensive solution to the issue of accessibility of healthcare facilities. It is a giant stride towards realizing the dream of providing top-notch healthcare for all.
So what are we doing here? You can pretty much overnight set up community clinics wherever we want to, with ultra-quick connectivity through 5G, through our air fiber. This is something that we are working on in bringing to the market as quickly as possible. Number two is that we have a solution which is called Clinic in a Bag, which is a bunch of connected medical equipment through which you can actually connect it to a remote specialist online, and the remote specialist gets access to all of the reports, everything on a digital platform. So it's all real time, right? And not only that, the digital platform actually records all of the patient information over multiple visits as well, so that the doctor also has access to the past history of the patient at any point of time, right? So it's a complete end-to-end solution based on connectivity, based on connected medical devices, and a digital solution. And of course, access to specialist consultation in places where you don't have access to specialists physically. Number two is connected ambulance. I think we've already seen this, so I'll just quickly go through. We will skip the video. But net in terms of the solutioning, what it does is that you have, number one is because it is connected on 5G, you have a GPS-based dispatch situation. At any point of time, the control room knows the live location of the emergency, basis which they can dispatch the ambulance immediately to that location. Then you have live tracking at any point of time, where the hospital knows at what point of time is the expected time of arrival of the ambulance, so that they can be ready to accept the patient at that point of time without any further delay. Number three is, of course, the core, which is the connected ambulance piece, right? And this is similar to what Airtel showcased. It's a connected piece, complete medical equipment, patient monitor, ventilator, etc., which transmits results wirelessly over 5G directly to the doctor. And this is a real sort of snapshot. So on the left, on the top, you see the doctor connected to the ambulance. You can see the monitors, live monitors that the doctor is actually seeing. And on the bottom right, you see the ambulance view inside, right? So therefore, you have a live interaction during the time that the ambulance is taking the patient to the hospital. So by that time, the doctor has already decided the sort of diagnostics and knows where to take the patient by the time the patient arrives. Number three is tele-ultrasound. This is remote diagnostics. Okay, and this truly bridges the barrier between medical experts and patients in a manner where you are using really high-tech technology, where people with that high-tech technology domain knowledge is not really there, present physically to conduct it. So let's take a look at this.
5G, an idea whose time has come. 5G is that technology which will probably bridge the gap between urban and rural healthcare. 80% of India's healthcare still remains rural. However, rural healthcare lacks because of access, because of affordability, because of availability, and these problems can be bridged with technology.
So, what does 5G do that 4G cannot do? Number one, it has a very high-speed fiber like bandwidth, which means you can transmit heavy high-definition images over hundreds of miles and live stream HD video stream instantly for accurate diagnosis. It also has a low latency, which means that devices like haptic enable radiography becomes much more possible.
This was simply not possible at 4G. 5G technology will enable us to get that degree of latency, which will almost be milliseconds, and that degree of precision and skill without being in the same place. For example, take the case of someone in a rural Mufasal area where he has only probably a paramedic around him.
On the patient's side is a portable position sensing robotic arm with 6-degree freedom of movement operated easily by a paramedic. The radiologist located miles away operates the arm with complete precision provided by a 5G-enabled haptic device which permits fine adjustments of the probe, including rotating, rocking, and tilting. In like fashion, clinical pictures and videos, X-rays and scans can be relayed immediately and with precision to an expert miles away. This can revolutionize early diagnosis of many of the most prevalent cancers, rendering treatment easier and kinder.
I do believe that that golden hour, which is very, very crucial in preventing someone from getting debilitating paralysis or from dying out of more myocardial dying if the right medicine was not given during that golden hour, will probably decrease because of this 5G technology.
It's usually more consistent and itself to live communication without quality-related disruptions.
So you will soon have almost like video call centers, you will soon have ICUs being managed by call centers of experts sitting far away, the patient in a remote location being managed only by paramedics.
So what are the social impacts? It basically bridges the gap in access with high-quality medical aid and critical care in remote areas. This is a new class of digital therapeutics which is delivered to the patients.
No longer will excellent healthcare remain the privilege of just a chosen few.
And that is what Geo aims to deliver. No longer is quality healthcare, given only to a chosen few, right? So this is basically one such example, robotic tele-ultrasound. This is a paramedic. This is not a doctor who's operating it on the patient. And the robotic arm has 6 degrees of freedom, so complete range of motion, armed with an ultrasound probe. And you actually have the medical expert, the doctor, sitting miles away with a haptic, with a haptic controller. And through that haptic controller and through true 5G connectivity, they can actually feel what is actually happening through the probe because of the low latency, right? And you have live diagnostics available, HD, high-definition images that are transmitted real time, and basis that, this all this makes. So basically, that's what we are aiming to do: true 5G for all and quality healthcare for all. Thank you. Any questions? I must warn you that neither of us is a doctor, so.
We have an interactive session after all the presentations.
Sorry, I didn't get the question.
No, we have a session for Q&A later after all the presentations.
Sure. Thank you. Thanks.
Thanks, Shantanu and Ashish, for showing how Geo is helping create comprehensive solutions to address the issue of accessibility through through community clinics, ambulance, and tele-ultrasound. Moving on, we will now have a presentation from Deep Facts, which is working in the domain of ECG monitoring, cardio and geriatric, creating a cardio and geriatric care platform. For the same, I would like to invite Mr. Vamsi Kartaram. He is the CEO of Deep Facts.
Good evening. Thank you for giving us this opportunity by Niti Aayog, World Economic Forum, and Department of Telecom. So we are Deep Fat, and he's my co-founder, Janardhan, and I'm Vamsi Karatam. And we provide a medical device and a platform and the service. Let me come directly to whatever the mission, what we have started in 2019 was to bring a gap, to reduce the gap between the doctor and a patient. What we call is the doctor next to us, or doctor next door is the service what we want to plant. Yeah? And we started with the device, and device looks in this model, and it is to be placed on the chest. And it provides an app, and it provides all the different vitals in 2 minutes of time. That's 120 seconds. We get a report, which can be in this format, where the doctor can take an immediate action or immediate steps, what to take, what to do with the subject to the next level. Coming to the problem statement, in India or in the worldwide, there's a lack of early warning systems and a zero emergency response system, and also a lack of guidance, a step-by-step guidance on the health issue. This is the overall solution we are providing, and let me come in this way, like in every family, there's a medical emergency in any time, right? At that point, the subject's caretaker or the relation handling that event is a tough. 90% of them take a wrong direction towards the medical support. So here we provide a device which monitors continuously, and our health command center verifies the data, checks the data with the caretaker within standard protocol, and provide and alerts them in advance so that the 60 minutes golden hour can be saved and can be taken to the nearest hospital through an ambulance service, because we capture the GPS location, vitals, everything on this device, and also we can provide a virtual support like a CPR or a first aid, which can make sure that patient is not gone into the critical state. And these are the solutions what we are providing: the vital monitoring data and health command center and step-by-step guidance. And this is the whole team we are working, and we are from IIITH Hyderabad, and we have incubated in IIIT, as well as we had raised funding, a grant from Nidhi Prayas on this device, and as well as on 12-lead ECG device. And this all works on a 5G technology on a real-time basis. And we are rolling out this device into 2023, Q1. Thank you. We are happy to collaborate with Airtel or Jio on this device if it's really help us to do this. Yeah. Thank you. Thank you.
Thanks, Vamsi, for showcasing your promising solution for the last mile delivery solutions. Next, I would like to call on Noor Fatima, Chief Technology Officer at EasioFi. The company is providing teleradiology solutions at the PHC level. Noor.
Good evening, everyone. Thank you for the opportunity that is given to us to present here. So I'm Noor Fatma, a Chief Technology Officer of EasioFi Solutions and the co-founder. I am also here with Sheetal. She's also a co-founder in my company. So here we are here. Actually, we are basically data visualization experts. So we started off as an augmented reality technology solution companies. And in the process of developing solutions and providing it in AR, what we did was we converted the CT and MRI images into 3D formats. We ran AI models on it. For example, if there is a brain with a tumor, so in the 3D model, there would be a brain with a tumor segmented, and that would be presented in augmented reality format on an AR glass and also on a simple mobile phone. So that information can be used by neurosurgeons and orthopedic surgeons to basically plan the surgery and also educate the patient about the prognosis and what the treatment has to be done. To get the data, the CT-MRI data, we were not using what is called the Jugaad model, like getting the data through WhatsApp or anything. We developed a robust platform which uses Google Health Cloud to get the data, and then it comes onto a platform. The AI model is run on it, and it is converted into 3D format and it is given to the orthopedic surgeon or the neurosurgeon. So here, the objectives today are understanding the gaps in effective radiology diagnostics, outline of a platform to provide teleradiology to the public health solutions, and setting up more CT-MRI centers because right now the CT-MRI centers are less, and as we continue after COVID, the need for diagnostic imaging is gonna increase a lot. And understanding how visualization technologies like augmented reality and virtual reality can help in patient outcomes. So the problems we already know, the challenges are that the radiologists, we have 15,000 radiologists in India and roughly around 1 lakh scans are being done daily. Then the radiologists are mostly available in urban areas and subspecialties, radiology subspecialties is not available at all locations. Now also during emergencies, it gets very difficult to get reports of radiology exams on time. And there is no reliable means. The teleradiology is being practiced on a private level in India, but it is being done through non-secure data channels, which is a problematic scene. And also using those channels, we are losing the data. We don't have anything to correlate the previous data with the new data or have that data to develop AI models and do a predictive analysis sort of something to come up with the predictive solutions. Through our platform, we can connect rural patients to radiologists in the urban hospitals using teleradiology platform. PHCs, right now there are just X-rays available at the PHC centers, but CT scans and MRI machines can also be provided they can be operated using radiographers, and then the data can be available to radiologists who can provide the report. And so the load on urban hospitals, the AIMS, etc., it would decrease. The patient will not have to travel just to get a scan, and he will know what the next steps have to be. So so the first level would be avoided there itself. So during emergencies also, the remote radiologists can use the platform to provide reports. And the 3D scan data, it can be also provided on AR glasses to assist during surgeries, but for that we need more robust system and a lot of regulation, a lot of compliances, etc. We'll have to follow for that. And anonymized scan data available for developing AI models for preventive care. So this is basically the platform. So at the PHC or the FRU level, we have the scans done which goes into our platform. We run AI models on it, and the report, the AI generated report along with the scans are available to the radiologists. So when it is available to the radiologist along with the AI generated, the load on the radiologist is less. The burnout is less, and so the efficiency increases. And the same data, it is available along with the patient vitals to the doctor who can do the reporting. And so the first level of reporting and the next steps are already there at the FRU with the patient, so that he can decide what he has to do next. This I have already told. Radiologists can report from anywhere, a common radiologist, and then AI segmented augmented reality mode available to assist radiologists and surgeons. So this is our platform. The data from the modality, it goes onto a platform where AI-assisted segmentation is done, and it is available on the mobile of the radiologists and the doctors in normal slides mode also, and also in 3D mode. These are a few screenshots of our app which is running on a mobile. The same data can be also available on an AR glass. So this is just a QR code to scan and see an open source COVID lung. This is the sample AI generated report of a COVID lung, which is presented to the radiologist along with the radiology scans. So this is our team. We have Meenal. She's not here. She's based out of Noida. So she's our business expert. I am the Chief Technology Officer responsible for developing the platform. Sheetal is the co-founder, and Dr. Munira is our radiologist advisor. We have a few more advisors who are working with us as we go on developing the models, etc. And I have a good news to share that we have been selected by Mighty and Meta for the Mighty and Meta exam program by IIT Delhi. I just got a phone call right now. Thank you so much. So that's it. Thank you so much.
Brilliant presentation, Noor, and especially all women's team making a difference in the field of teleradiology. Many congratulations. Moving forward, I would like to invite now Mr. Rajat Jain. He is the founder and managing director of SunFox, which has created a solution in the field of ECG monitoring.
Play the video first.
Around the world die due to heart attacks every year. And to reduce the preventable deaths, we have to focus on prevention and timely treatment. The gaps with the currently available cardiac monitoring point-of-care devices for last-mile users are making this challenge more complex. We are solving this biggest global health challenge by providing the accessible, simple, and affordable product innovation. Spundun is a matchbox-sized cardiac monitoring equipment which can monitor ECG with clinical-grade accuracy, detects 40-plus abnormalities with edge-based AI algorithms, needs no expertise, and can be used anytime, anywhere. A cardiac patient can do his cardiac screening using Spundun sitting at home and can get to know about the cardiac abnormalities instantly without any doctor anytime. In other cases, a doctor at clinic can do instant screening on a patient so that the right treatment can be provided timely. Also, a cardiac surgeon can monitor his patient remotely anytime. We started with a vision to disrupt the rural point-of-care cardiac diagnostic market. But later, we found out that it's not just rural India. Most of the parts of the globe need this solution desperately at home. We have saved more than 2,000 plus lives and diagnosed more than 20 million heartbeats. Spundun ECG got featured on Shark Tank India Season 1 and won an incredible all-shark deal. Spundun managed to prevent heart attacks in the Kedarnath Yatra, organized free ECG camps for pilgrims that resulted in huge decline in deaths due to heart attacks. Spundun has become the leading portable ECG brand globally, and our team is striving to work harder every day in order to save as many lives as possible.
Hello everyone. Honored to be here. Thanks to Niti Aayog and World Economic Forum for this opportunity. So we believe in simplicity, and I'll start. We all have a thermometer at home, but we don't fall sick every day. The idea is to have a thermometer at home. We should have it when we need it the most. I'm born and brought up in a small village. I've seen people dying around us, in the family, in the neighborhood, and relatives. We hear that somebody has a chest pain. We thought it's a gas pain, or somebody who is having a chest pain. Till the time we reach the hospital, the patient is no more. So these are the normal, day-to-day use cases which we hear about, and even in this era of 5G, we still have more penetration of a lead-based thermometer at the last mile than a digital thermometer. So we thought how we can solve the problem, especially in the life-threatening cases. So we started this venture in the beautiful place called in the foothills of Himalayas. Building this venture beautifully, grown to a team of about 80 people, been appreciated by Honorable Prime Minister, and we have achieved a milestone of recording 20 million heartbeats in last few months. So the problem we all know, cardiovascular disease and heart attacks kills more people than any other reason, and even including this COVID time, it has killed more people than COVID. So the device we have built, it weighs only 12 gram. It works with a smartphone. No expertise is required. No training is required to use the device. It gives you 99.7% accuracy in multiple languages, and though it is compatible with 3G and 4G, but we aspire to take it to the next level with the 5G. So these are some of the real deployments which we have done. When we talk about the ambulances which are powered with 4G or 5G technology, so a patient is actually brought to the ambulance, where we can even provide the first level of care, and even we can go up to thrombolysis stage within the ambulance itself till the patient reach to the hospital. These are the real deployments in the ambulances. When we talk about doing it at home, for the self-monitoring at home, the device come with no maintenance. You put the device on the shelf for 3 years, and you don't have to charge it, because this is not something which you can use every day, or you can maintain, but it will surely work when you need it the most in the emergency. So patient can use it at home, share as simple as that, you share it on WhatsApp with your doctor, or we also have a edge-based interpretation immediately. And even we work with companies like Healthians to provide ECG at home within an hour. Also, we did deployments at more than 800 primary healthcare centers, where patients can get immediate cardiac diagnosis at their location itself. So these are a couple of the deployments in the very remote Himalayan regions. When we talk about the digital clinics and the smart health kiosk, this equipment is developed in such a way that you can plug it to any any platform, and it's not platform bound. So you integrate it, and you start getting the digital data immediately. And the best part is the test per cost. Cost per test is less than a cup of tea. We provide per test less than 10 rupees. These are some of the integrations with the smart health kiosk. And we are now trying a solution where we can deliver the basic medications along with the ECG to the remote locations, as we discussed with a lot of drone companies here. We are happy to collaborate to do this pilot as well. So I want to share a little more about our effort at the grassroots level. We all know about Kedarnath. So in Kedarnath, there is a 20-kilometer trek from a place which is a base camp called Sonprayag. This year, Kedarnath witnessed about 1.5 million pilgrims coming there. And in very first 2 months, the yatra started on 5th of May. So from there till 7th of July, the day when we started the camp, 107 people died. Out of those, 102 died just due to heart attacks. We started doing just a preliminary screening to flag off the patients, and also provided the triage without a medical doctor actually being there, just with the paramedic staff. And we have achieved a significant reduction in the deaths, which was as high as 100 per million, and we reduced it to as low as 12 deaths per million in the rest of months. This is one of the other efficacy and efficiency study which we got it done by a agency. So where out of the participating doctors where we deployed in the remote, so more than 95% feels that from performing ECG to monitoring the high risk patients and generating the report, they improved the access, and there was a significant change in the awareness to the symptoms being correctly diagnosed at the last mile. So this has been the impact so far. We have recorded about 20 million heartbeats. We have 15,000 plus daily active devices. These deployments happened in just last 12 months. We have delivered the devices to 12,000 plus pin codes from Dehradun itself. And we are currently active in 500 plus villages, 800 plus clinics are empowered, and made a significant impact to save lives. Thank you so much. We are happy to collaborate with the stakeholders here, from the telecom platforms to the drone platforms and the other research organizations, to join hands and make a bigger impact. Thank you so much.
Thanks, Rajat. A remarkable solution of making a 8 leads ECG monitor to a pocket-friendly and a handheld device. As we move forward, I would now humbly request Mr. Suman K. Berry, Vice Chairman, Niti Aayog, to please come on the dais and, sir, enlighten us with your thoughts and feedback.
Thank you so much. This is slightly out of sequence, but I requested the change because I'm a nervous traveler and I wanted to make sure I made my flight. The traffic in Bombay today has been truly miserable. So let me first start by thanking all those who have convened this event. And I am the despair of my staff, because they prepare very detailed talking points and notes, and I never stick to script. But I do want to say that I am so grateful to them and to the organizers for bringing me here, because it's a whiff of the new India, the modern India, and it has been very stimulating, even though I've been here only an hour. So I may finally turn to my prepared remarks, but for now, I'm really going to, as it were, freelance or extemporize on some of the thoughts that have gone through my mind listening to these very inspiring presentations in the last hour and a half. Speaking as a development economist and also, of course, now as the Vice Chairman of Niti Aayog. But let me first start with thanks to the organizers of the event, not just my own colleagues, but the World Economic Forum and also the Department of Telecoms, and the support that has clearly been provided by major telecom private sector telecom providers, both Jio and Airtel. So speaking as a development economist, I want first to share a term that development economists use, or that is widely used, which is emerging markets. Many of you would have heard the term emerging markets, and yet you would find, and India is regarded as an emerging market, but in other work we have struggled to define exactly what we mean by an emerging market, and if you like, a heuristic, informal definition of an emerging market that we came up with is a society, a nation, which has the capacity to forge its own solutions to its own problems, okay, and is not therefore completely dependent on, as it were, solutions coming from outside. And more interestingly, and that's really the issue on which I requested an intervention before the open discussion, that innovation be disruptive on a global scale by coming up with lower cost solutions that might come out of the rich countries, the G7. So we look to the G7 for, the G7, sorry, that's another term of economists, but if you like, you know who they are, the West, let's call it that, and Japan. We look to them as really setting the pace. But I think what we have seen in the last 20, 25 years is that the growth of capacity in the emerging markets has been such that it can be disruptive and therefore even threatening to the rich countries. And a case in point, obviously, is the rise of generics, which has created a lot of consternation in the pharma markets of the rich countries. So India is, from that point of view, I think now, an important emerging market. And so one of the, if you like, prisms or lenses through which I was listening to the discussion is both, are we capable of coming up with our own solutions? And second, do these solutions in time have the promise of being scalable globally and disruptive globally? So it's early days yet. 5G has only just come, and I will not comment on the discussion of drones because I was not here. But just what went through my mind. Now, related to this is a question of R&D or innovation. Let me not call it R&D, innovation. Obviously, we would not be, we need innovation in order to come up with homegrown solutions. And there is a lot of concern and criticism that despite its, well, both despite its substantial scientific establishment and also the fact that in, if you like, corporate research, many international multinationals have set up captive research labs, particularly in the south, in Bangalore and Hyderabad, that actually India, in terms of patents and other indicators of basic research, lags, and certainly lags China, Korea, etc. And my response to that, very much stimulated by the rise of Airtel, which happened in the 20 years that I've been here, was to say, and this is not really relevant to the startups that we've heard from, but really relevant more to the, the 5G story to some extent, is that India should let the heavy lifting on basic research, which is going to be particularly important in energy and climate change, leave that to the people with deep pockets, the United States, Europe, etc. But really that where we have proved our capability and capacity is what I might call business process innovation. I was very struck in the early days of Airtel how, in a sense, the whole mobility model that came at that time largely from Europe was turned inside out by Airtel itself focusing really more on branding and marketing and outsourcing many of the technology functions. And I would be looking out, for, in a sense, similar innovation to be taking place on the management and business process side, as we go forward with 5G. That's not the topic of this conference or this meeting, which is really about use cases. But I just wanted to say that we are on the edge of another very exciting, as it were, commercial breakthrough. And I think that I would hope that our environment is competitive enough that, that the incumbents and newcomers and the regulators would encourage business process innovation of the kind that the industry has been known for in the past. This then brings me to a third point. Now, emerging markets have had a rough time because of, excuse me, could I request a glass of water, please? Because of various shocks coming from the outside world, but they have also shown their resilience. That's fine, thank you. But there is a phenomenon that economists have called the middle income trap. So India is what we would call a lower middle income country, but there is some suggestive evidence that, you know, countries that grow fast for a while then run out of steam. This happened with Japan, it happened with Korea, it seems to be happening to some extent with China even as we watch, although it's too early to say that this is going to be forever. And, you know, the underlying intuition is obviously the larger you are, the harder it is to grow. So that's not that mysterious. But, and this is where, this is what brings me to, as it were, this event in Niti, it is argued that part of the reason for the middle income trap is because the old ways of doing things, you know, ministry-led or oligopoly-led, no longer work because the society is becoming more complex, the needs of the society are becoming more complex. And so you need new institutions and new mechanisms for, as it were, people at the leading edge to work with each other. And it is in that context that I am so pleased and proud that colleagues at NITI have the network to create a forum that brings together government, industry, NITI itself, because, you know, let's be clear that these are not fora that were that well established in the past. And as somebody who's lived a large part of my professional life also in the US, I think you will find that it is intermediating institutions of this kind which are very certainly prominent in the US. I would say they're more prominent in the US than what I saw when I lived in Europe. But all I want to say is that Honorable Prime Minister, you know, rejected in some ways the old planning commission model for something that's more flexible. And I'm very, very pleased that, you know, that staff at NITI under the, if you like, suggestion and stimulus of the PMO are able to reach out and create platforms like this one to bring, as it were, multiple stakeholders together. I think this is very much NITI's role, and I'm very pleased that the Line Ministry believes that this is not intruding on their space, but is adding value to it. And so I just want to compliment my colleagues. I'm sorry that my honored member, Dr. Paul, who is a leading figure behind this, has been pulled away, but I would like to acknowledge his leadership as well. Turning now to the present rather than, and then finally to the future, we are very excited about 5G, and rightly so. Let me voice a couple of misgivings on, or concerns on where we are on 4G on the basis of my limited experience in this job. And as you might know, I took charge only on the 1st of May. So a general issue, and I have been advised by colleagues, by senior officials in MeitY, that they're very concerned about this, particularly in the financial sphere, but it could apply to this as well. As we go digital, we must be sure that digital is inclusive, and that all of the, as it were, things that come so easily to the young don't end up being a barrier to entry for the less sophisticated and the old. I don't know whose responsibility that is. I would assume there's a commercial case for that, and so in large part, access is a responsibility of the of the private sector. But I think in all of this, ease of access or alternatives to, as it were, digital should be thought of. I'm thinking, for example, there used to be a theorem on toll roads that yes, you can charge a toll on a road only if there is a non-toll equivalent. It can be slower, but at least you're not forcing people. And I'm just making an observation that a similar sense of redundancy and parallelism ought to guide us, or ought to haunt us, even as we try and explore the technological frontier. The second, as it were, legacy issue, if I could call it that, which has now been borne home to me twice, once on a visit to Odisha, which of course you know has a substantial tribal area, and to Jharkhand, and also Uttarakhand, is an assertion which we are trying to investigate, that look, substantial remote areas remain underserved by the established players, and that the only option, this is despite there being a universal service obligation fund, and that therefore the only option is to resort to BSNL. I have no difficulty with BSNL, except that it seems to chew up large volumes of government funds. But all I would say is that we know that the best quality of service is delivered when there's competition. And I would just urge the established private players not to give up completely as beneficiaries of the USO, because broadband access to the last mile, not just to the panchayat, is and should be a human right in the 21st century. And while I know that the charges for spectrum, etc., and you all have to make a return, I would just say that in the way that AT&T, when it was the monopoly telephone provider in the United States, took pride in the universality of its coverage, I believe before we, as it were, go chase, or in addition to chasing 5G, I think that there needs to be an equal concern for, as it were, full penetration of basic services. And of course, you all know how crucially important that became during the pandemic. So I would just say, yes, this is about the leading edge. This is about interesting new use cases, but let us not, as it were, forget that there's unfinished business to take care of. And I'm making that plea here because, frankly, I've not been in a room with the technology officers of the big players. And I just thought that I would miss in discharging the messages that are coming to me by honorable chief ministers if I were not to say that this is also on the agenda as you play with your shiny new toys. Now, finally, you know, the prepared remarks that I was given was, of course, the vision of Viksit Bharat, you know, turning India into what we would call an upper middle income country by 2047, and a very important element in what Honorable Prime Minister called ease of living, in addition to the effects on productivity, have to do with health. Now, a lot, not all, but a lot of the use cases that we've been talking about in the afternoon with 5G have been about emergency health, the golden hour. I would hope that there would be as much attention to something that India used to be good at, but has neglected, which is public health. So what the 5G use cases are also in public health. Now, to some extent, screening for diabetes, screening for cardiac are very important for public health. But this, to some extent, is linked up with the other point I made, that until and unless either through BharatNet or through USO, we can ensure that each primary health center, each Gram Panchayat is linked up with reliable broadband, and thereafter, whether that broadband can also be used for 5G, we will not be able to realize the potential of this very exciting new initiative. Finally, let me just repeat the point that I made earlier, which is that, and in this G20 year, I'm becoming particularly aware of this as people come through my office. India doesn't realize the extent to which it is an admired role model for other smaller countries, certainly in Africa, even potentially in Latin America. And so be aware that, well, certainly that the eyes of the world are on you as you experiment and innovate, but also that to some extent, both from a commercial point of view as well as a diplomatic point of view, this complex of entities, Niti Aayog, line ministries, the major telecom players, even the startups, should be actively looking for international opportunities. I was very pleased to see that the first presentation, the Yoga 5, is already present in many markets. It has been one of the remarkable achievements of the big technology platforms that they have gone global to the extent that they have and at the speed that they have. And so I think an additional agenda that Niti Aayog should be exploring, particularly with DOT, but also MeitY, is to ask, so what does it take not only to go from deep science startups but to facilitating their rapid expansion or diffusion through the world. So I will apologize to my colleague who worked hard on preparing notes that I've only barely used, and also congratulate particularly those of startups, those from the startup community for their, if you like, vision and entrepreneurship and boldness, and the World Economic Forum and the Line Ministry. Thank you for the opportunity, and I'll stay as long as I can. Thank you, Anna.
Thank you, sir, for your astute comments and keen insights. And I'm sure the representatives of the industry and the friends from the startup ecosystem who are present here would agree with you that India is one of the most potential emerging markets. And I'm sanguine that the disruptive innovations, what they are creating, will create a dent in the public health space, which has been neglected, as you rightly said. In the series of presentations, what we have been having, last but not the least, I would like to call on Mr. Manmohan Jain. He's the founder and CEO of Swasa, which works for screening of for respiratory health solutions. Mr. Manmohan.
So while he's setting it up, good afternoon, everyone, and thank you, Anna and Dr. Umar, Dr. Anna, to giving me this impromptu opportunity. You're talking about public health, and what I'm about to show you is a solution that would be is useful for screening for respiratory health. There are a lot of solutions related to cardiac health. There are a lot of solutions that use images. But this
is an ultra-scalable and affordable respiratory health platform developed as a point-of-care solution for triaging, monitoring and surveillance of various respiratory diseases. Swasa uses audiometric analysis to analyze the cough sounds using ML models to detect respiratory ailments like tuberculosis, COVID, COPD, pneumonia, etc. Typically, when a patient consults a doctor with respiratory ailments or symptoms, the doctor can advise Swasa test and other possible diagnoses. A small and quick enrollment can share the web link with the patient on their phone. The patient can start recording cough sounds in their Swasa application. The results are instantaneous. On one side, the patient can see their preliminary assessment of their lung health and associated risk. Simultaneously, the doctors can access a detailed report of the cough sounds on their web dashboard or mobile device. The report provides general lung health read comprising of spirometry results followed by identification of various respiratory diseases. In cases where the symptoms indicate a high risk, the doctor can choose to refer the patient for additional tests for further treatment. Swasa is developed and maintained by Salsat Technologies, and we are committed to making
That's okay. So, I mean, in the interest of keeping it brief, I do have a presentation, but we'll skip that. I'll just give you a brief overview. So, as I said, the difference is we are using ML to audiometric analysis. We took samples of a lot of cough sounds, thousands of cough sounds. We worked with Nizam Institute of Medical Sciences in Hyderabad and Apollo Research, and kind of found that cough sounds have certain unique signatures for different respiratory conditions. So using that, and we said that earlier some of our initial innovation involved like having a jacket and everything, but then we said, can we strip away all hardware and go with something very simple, which is just using a mobile phone, which is something that, it's so prevalent. And we talked about 98% 4G penetration. So this is especially useful in remote rural areas where access to a spirometer, the traditional way of assessing lung health is through a spirometer. But that's like expensive equipment, requires a trained technician, requires a specific time. So our idea is that Swasa should make respiratory health screening unbound. It's unbound from the constraints of time, of expertise, cost. So that is the real challenge that we took up on, and happy to say that we have made some good progress. In fact, recently, last month, November 17th, we were the winners of the Anjali Mashelkar Award for Inclusive Innovation. And At this point, we are also, the science behind this is backed by a few patents and several publications. We have done clinical studies. 5 clinical studies are completed, 2 more are in progress. Andhra Medical College, CMC Vellore. And in terms of deployment, Apollo Clinics is one of our customers. Piramal Swasthya is using it in their mobile medical units in Assam. They're talking to other organizations like Healing Bay, Government of Orissa, the National Health Mission Director in Government of Orissa, we met them. So far about 3 lakh assessments have been done on the platform, and it's growing. So I mean, I could go on talking about it for hours, but I know that keeping interest of time, I really would love to have an opportunity to talk to the various health secretaries in different states to see how we can take this forward. Our mission, we have, just to be clear, I mean, a lot of you might be curious about the commercials. As an organization, what we have chosen is that we will make our money maybe through the private sector, through global markets, and for the public health, in India, we just want to, just at cost, So at scale, the cost can come down to like 1 rupee per assessment. Thank you. Yeah. Any questions, or we can have a Q&A later. Yeah.
Thank you, Mr. Jain. Now I will open the house for questions, comments, and feedbacks. I will request you, in the interest of time, to please keep the questions and comments very brief. I think we have a question at the back.
When do we expect 5G in Northeast? Arunachal Pradesh, to be precise. Yeah. Yeah, December 2023. Every town tehsil is what I said. So.
Because when I looked at it, 5G, more than 5G, as a health secretary, it looked for me as augmenting my health services. So, more interested than me using 5G for my phone, I wanted to use, and I wanted to see that
teleconsultations, telemedicines, kicking off
so that's
in a big way in our state.
That's the beauty of 5G, right? It's truly transformational.
Yeah.
And as an industry, and as definitely from a Jio's perspective, we definitely want to use the power of 5G to transform healthcare, definitely, including, in the India Mobile Congress in October, we showcased 35 use cases of 5G, and we were not done, right? We didn't have any other. So there is huge potential, and we really want to sort of move as fast as possible.
Yes, please.
And we are doing that.
Earlier than December 23 would be
great help for
December
us. December 23 is all India, right? So we will be there much before that as far as the key locations are concerned.
Yeah, thank you.
Just want to add on what you are asking. So 5G rollout is taking place, and they are committed to roll out by December end, every corner of the country. But 4G is available as of now. And the teleconsultation, all those things which are not mission critical kind of applications, they can be riding on 4G also. So we can have the discussion with the operators. Okay. Some projects are going on, some Airtel and Jio are doing that.
So what I was trying to say is that most of the issues that arise in health sector, especially in Arunachal Pradesh, the far-flung PHCs, for example, the major issue is that of connectivity, internet connectivity, because of which we have the systems in place, we have the trained personnel in place, the systems are downloaded with all the software data and all, but the major lacuna that we face is that of the connectivity, because of which the data doesn't get uploaded on time. So that's like we are implementing the hospital management information system, wherein which we want to take all the hospitals, district hospitals and health centers, about 800 of them in Arunachal, and centrally monitor them. But most of them, which are in far-flung areas, have this connectivity issue, even at 4G level. So that is something which we would like to bring it to the notice of DOT, so that, something, of course, there is much emphasis after our Honorable Prime Minister has said that in Northeast, every village has to be covered with 4G at least. He has given a target. But that is one thing that I would like to highlight here, that we do face some network issues in Arunachal. So, and not in the city headquarters per se, but yes, in the remote possible PHCs and all, there are issues.
I want to add something here. As Member Technology mentioned, see, the way when we get 5G rolled out, we have seen in 4G, we use the lower spectrum bands. When we go to 5G, we are going to use spectrum bands which are higher. Means attenuation is higher. The coverage area will be still lesser. So all said and done, when we roll out 5G, still there may be some packets, some unconnected areas. What our submission is that, as some of my colleagues mentioned, 4G is going to be covered in entirety. 4G, in fact, can give almost equivalent to 100 Mbps. So most of the applications, when you look at connected auto-converted ambulance, or wearable jacket, some of them showed, they very well can work on 4G.
Yeah.
If you look at what has happened in Indian digital transformation, when we adopted 4G, 4G mostly worked for the mobile voice and data. It did not enter into socio-economic verticals the way other countries adopted. So the opportunity here, when we started looking at 5G as a use case applications, we have realized that 4G itself could have done wonders had been adopted in the way it could have been. Like, for example, unconnected areas. Australia has been deploying fixed wireless access for the last 12 years for the unconnected villages. Even now, Indian-made 4G FWA are available. If there are any such locations, my request is that kindly take up with the service providers. They can deploy connectivity to your PHCs where it is not there. So all that sub-millisecond critical kind of applications, rest of the applications, please be assured, they can be deployed with the current 4G.
That would
kindly
be
try to get the opportunity, because
sure.
even after 23 December, I'm sure that they will do their best to cover. But the very physics of 5G itself is smaller coverage.
Correct.
Still,
so
there could be packets.
If the entire state gets 4G connectivity in its full
So my
throttle.
request is that let us pursue the applications what could be deployable with 4G. Please deploy them. That itself is going to make wonders in the this
field wireless connectivities. You said no, sir.
Yes.
Fixed wireless.
Fixed wireless access.
Okay.
So even in 5G, if you look at fixed wireless access, is something where rather than laying the fiber, especially I can understand Northeast, laying a physical cable is a challenge.
Correct.
So in wireless, they can provide the connectivity. Same thing is available in 4G also.
Okay.
Please take advantage of that. Yes.
Thank you. Thank you.
Hi, my name is Ankur. I'm from Reliance Industries. So my question was with regards to the session in the morning, drones and medicines from the sky. So given that medicines so we're talking about medicines and consumables moving from one location to the other. So would these be medicines which are moving at room temperature, because vaccines and so the issues around temperature, issues around contamination. So I'm sorry. Yeah.
Dr. Sumit, can you answer that?
Yes, there is a range of products. Like if you talk about -20°, there is frozen section. You will come to 0, the blood bags. Then you come to a 0 to 8°, vaccines are there. Then there are things like medicines, normal medications. So there are spectrum of temperature. So there is requirements of spectrum of requirements of the things. Should be no like hemolysis is, if I take one product like blood bags. So there is hemolysis, very important component. If you cannot give a hemolyzed blood to any person, So it is not just putting things in a box and transferring to the one place to another place. So there are temperature sensitive things, vibration sensitive things, then climatic changes, then the contamination as you mentioned, then the packaging of tissue, cryogenic tissue. So there are so many requirements which needs the specific payloads to be designed, and that these specifications are needed. So everything can be handled, but these all things needs validations. Like first, when we tried vaccines, so we took dummy vials from Bharat Biotech and we validated in IIT Kanpur. Then we implemented in Manipur and Nagaland. Now we are talking about transportation of blood bags. So before transporting of blood bags, we need to validate, because this is very sensitive biological material. There should be no change in sodium, potassium, LDH, hemoglobins. There should be no hemolysis, rupture of RBCs. So we need to validate all these things. So so that is why there is a need of validation before implementation. What Dr. Paul sir was saying in the morning, so there is an implementation, and before implementation there need a validation. So that is important aspect of that.
Good afternoon to all. I am Ashok Jha from DDG TEC Mumbai. First of all, a big congratulations to all the people who have participated over here. And we are, excited, glad, what words, I don't have much words to tell. But this was wonderful, from all the startups and everybody who has done so marvelous works. So that was my just feeling of gladness I just wanted to express. And my question is from our friend from Jio and maybe Airtel, that when we are doing this mobile ambulance and we are trying to operate through 5G, so there may be some patches where our network may not be so strong. So how do you deal with that patch? Is there anything, do you want to put a BTS itself on the ambulance or something like to take care of that, because you have started the diagnosis as soon as the ambulance has started? Thank you. You can just.
So we have the fallback mechanism whenever we build these kind of critical use cases. So if let's say there's no 5G coverage, it will fall back to 4G and 3G like that. So bare minimum, we will ensure like the network is seamless. And that's why 5G is coming into picture, because these use cases, why 4G was not successful, why 5G? Because network slicing is a concept which ensures the quality of services. When you are moving in a high speed, you need a lower latency and high throughput. That can only be permissible with 5G. That's why we are bringing these use cases with 5G. 4G, it will work, but some deterioration of quality will obviously there. So there could be chances, but 99.99% yes. 1% is still 0.01%. There could be chances like that, which you mentioned.
So are we planning that we should have some sort of BTS on the ambulance itself? Like, do you imagine something like that, which may help, like, it's like a mobile BTS, of course. It's not a fiber operated BTS. Now such BTS, you can take a signal from the nearby BTS. They can serve as the backhaul. If you can think of something of that line, probably that.
Yeah, those technology is evolving, yes. Based on the cost factor and all, we can obviously implement, but obviously cost will go higher.
Because wireless backhaul, anyway, we are going to use in 5G. That also on large scale. So what I say that you put some BTS on this also as a backup option. And while you are moving, you try to connect, take backhaul from other BTSs or something like.
Good suggestion.
Yeah, that's what I meant.
Still try.
Yes.
Thank you.
Thank you. Thank you.
Thank you, all the startups who presented their technology, 5G based. Just one question, since you all presented your technology, there did not seem to be any ask from you. That is also we were looking forward to, that what is the ask. So if any, either from drones or from the second session, if any of the startups have asked, that would be really wonderful to know at this stage.
Thank you very much, ma'am, for giving this opportunity. So, as a drone delivery or drone ecosystem, so there are a couple of bullet points that we wanted to highlight. First thing is that most of the applications are lying in the BVLOS regime. So again, reiterating that we should fast track the BVLOS type certification by pushing it through the MOCA and other agencies. On the commercialization side of it, most of the projects are in a POC stage where startups are running out of, let's say, funds to deploy or to scale at a level where we can even come up with a business model full-fledged for a district or a state. So maybe Ministry of Health should come up with a scheme of 100 to 500 crore kind of a fund, along with ICMR as well as other government agencies, to adopt certain states which are in requirement and prove that business model, operational model of drone delivery for all sort of items along with the healthcare, and that can be adopted further by the businesses and can be scaled further for the public. So these, so basically pushing the commercialization and pushing the type certification and the compliance, basically. These are the two major asks that I wanted to put. Thank you.
Hello, ma'am. I have 2-3 specific questions. So even for the proven technologies and the validated technology, if I talk about in case of our product, it's from the cost side also, if the product is effective and economical, and it has a good amount of validation also, but we still see a huge friction in adoption coming from the stakeholders. So as we see, the platforms which which are on the public side, they see a lot of, they have a lot of friction. And secondly, there is a, kind of a gray area in the adoption mechanism also. So, whenever we go speak with these bodies, so they don't have a clarity on the adoption mechanism. How should we do that? And in case sometime, you have to push, why should we do that? We don't have a specific, allocation or mechanism defined for that. So that is a challenge. Secondly, as we spoke about the platform for the test beds, startups feel, I think, there is a challenge from the regulatory side on the, economics of it. So if I want to get the product regulated, so, say Indian as well as the international standards, like say US FDA and, CE mark and something like that. So I think we need something specifically where, maybe we should have a framework or some mechanism to support startup go through these processes cost effectively. Because if some startup is putting, a 7-digit budget just to pass the regulatory hurdle in the very early stage and put a lot of time into that. So I think that delay the go to the market and the commercial application of those technologies. And I think that can be something which can be looked at. Thank you.
Yeah, so I'm Dr. Harpreet from ICMR, and one observation, and then that will we kind of one challenge the startups have not asked, the startups which are dealing with AI-based solutions for disease prediction and modeling. How do you validate your products that you are developing? This I have seen couple of products which uses image modeling, and then Swastik I've seen from Mr. Jain. How did you validate these products? So this question is related to from where you get the data. So I think this can be one of the challenge which startups should ask from the government. They should provide validated gold standard data sets to startups so that they can develop better products. So this is, I think, my observation and my suggestion.
If I may. Yeah, that actually was one of the asks that I was about to ask, because for us, that's when we have done validation by collaborating with certain medical colleges, but definitely, and this is a conversation we've been having with Dr. Manjula, by the way, so she's aware of a thing. Coming to, I mean, I know this session today was about, drones and 5G, and what I missed on mentioning is the respiratory health screening solution that I talked, what it can have in terms of collaboration or leveraging the partnerships with drone companies and drone providers, as well as with 5G. So for example, when you're doing screening for tuberculosis, and ours is a very preliminary screening, indicates that there's a risk, then you need to have someone go in for a sputum test or other things. And we talked about, remote areas, northeast, etc. Just getting that diagnostic result could again be a turnaround time of about 5 days probably. You send the sputum sample, get the result. Now, if somebody is a suspected tuberculosis case and TB, 5 days turnaround is that many days of risk of exposure to family members and others. So cutting that down by being able to send the sample and getting your result back, like they said, maybe in the 90-day or 24-hour-a-day turnaround, that itself brings down a lot of the prevalence risk of and exposure risk. Secondly, in terms of the 5G thing is that if the preliminary screening just through the audio screening indicates there is a risk or high risk, immediate teleconsultation, video consultation through 5G could be possible. Or if we think somebody is suspected of tuberculosis, but it turns out it's not tuberculosis, then there's something else that needs to be diagnosed, right? And also the software we have has like trends, because the person can cough because it's low cost and requires no equipment, you can cough multiple times a day or multiple times a week. So you start setting a baseline and seeing trends, which means that if something is going out of your trend, then proactively, like an exacerbation and emergency can be prevented. So that's right. And I would reiterate that because what I had in my notes is Dr. Paul, Honorable Paul, was mentioned in the morning that, the pathways to test in real life and those sites, field sites that they can help with, like they had for the vaccines. Similarly, sites or data for us to test and validate. So not only data to refine the algorithm, but after that also to deploy certain pilot sites. That is an ask from us.
Yeah, so one of the key points is the availability of data. So right now, whatever data we have validated, we have tested, those are open source data and mostly from outside of India. So from India, we don't have the proper data to come up with solutions which are basically, which would cater to the Indian population. The second part is the availability of test beds and test sites where we can validate a solution, come up with data to show that yes, it is working and it would work in a country like India. So that is what as startup we want, and obviously funds to work. That's it. Thank you.
Any other points? Yeah, please.
Yeah, hello all. I am Suraj, co-founder of Maru Drones. We have been part of the Medicine from the Sky project in Telangana. So one thing I wanted to mention, like actually mentioned by my friend Vikram from Tech Eagle. So commercialization is one of the toughest point in all the drone delivery projects, especially for medicines and in the healthcare. We all do POCs and we build technology, do POCs and run across, but there is no long-term visibility of the business model, because of which it's hard to get investments from outside, and also the support from, that's the reason we need support from the governments, especially in the initial few years, to actually take the business to a particular stage. So that is one thing. And apart from that, like I have been hearing many stakeholders asking for the 20 kg, 25 kg and different kinds of payloads. And the health infrastructure is differing from state to state. So it is not the same. So the requirements will be differing, like somewhere we need a 10 kg payload for 30 kilometers, and somewhere it is needed 20 kg payload for maybe 20 kilometers or something like that. So if there is a way for us to understand the health infrastructure in different states better, if there are any white papers or anything that can give us better indication, or as many of the stakeholders are here, maybe we can all put our thoughts together to define the problem statements. And clearly, in terms of what is the payload that is required, or is it middle mile or last mile delivery, and how much distance are we looking at, things like this. it will make our lives a lot easier to think about the technology, how to build and what to do. So that would be another thing that I would request. And apart from that, like I see this event has added a lot of value thanks to World Economic Forum, Niti Aayog and other stakeholders. But many times I see the learnings that are coming from all these events getting lost after the event. So if there is a way, like I have seen from the Quality Council of India, that all the webinars that I have been conducted related to the certification process in drones, everything is compiled on their website in terms of FAQs. So I felt that that is a great initiative. If there is anything like that that we can do here, again, that would be a great help to take these things forward. And last but not the least, so I might be asking too many things, sorry. So Medicine from the Sky in Telangana, World Economic Forum has put out a beautiful report in like giving out all the details. There are so many experiments happening around in Meghalaya, Arunachal Pradesh and many other states, but we don't have much information about what is happening. So it might be on the unit economics front, it might be on the payloads that have been transported, the deliveries that have been made, the learning that we have got, or there might be unfortunate incidents also that might be happening in all these trials. So all these learnings will help us to make our product better. Ultimately, we need to play it really safe for drones to become a bigger project. So all these learnings should be compiled, and if they can release a report or a real-time dashboard, that would be helpful. Yeah, that's it. Thank you.
Any other questions? I think Dr. Paul is still busy with that important meeting he was called up for. So we can close and we have some takeaways. Yeah. He has a mic.
Actually, what has come out today regarding this ambulance thing, I would come back again, which is a very much life-saving thing. And what I discussed with our friends from Geo, that there are certain patches where 5G network will not be there. Suppose Geo ambulance is fit with a Geo connection, and it is not there. So what I propose, and in which Health Ministry and Niti Aayog can play a very big role, is like this. Such ambulance has to mandatorily have connections from two operators, say Jio and Airtel, because they will be the primarily operators operating in the field of 5G. Others are not yet, may not be able to roll out till now. And once they are having both the networks, so it will be seamlessly, like whenever one network is down, other will pick up. And then that connection won't be lost. And they would be getting continuous feed in the headquarters, like where doctor is sitting. But that will need some incentive to the ambulance persons also, like hospitals who are owning that, because they may not afford to give two connections, suppose, on an economic basis. And they need to be given some incentive or some convenience to do it. So in this particular aspect, both the Health Ministry and Niti Aayog probably can play a role. And by making it mandatory for the ambulance, the beneficiary will be directly the public, because ultimately patient is public. So once we have that seamless connection, probably public will be highly benefited, and the project can really take off with a lot of trust from the people and patients. So that's my request.
Thank you. Are there any other points? So we can then conclude, if anybody wants to make any point.
Thank you very much. As part of, when we are coming to the conclusion of the session, let me first thank Madam Annarai for her expertise as well as support for facilitating devotee to share our inputs and as well as actions what are happening in devotee headquarters. Somebody asked about, how do we validate the data, who is collecting the data? These are very important factors, right? Member Technology Digital Telecom Commission, he heads an interministerial committee with 21 departments. In one of them is health department is one among them. What we have asked every vertical or every department is about identify a COE who carries out these pilots, okay? So Ministry of Health and Family Welfare, they have identified National Health Informatics Center, which is I think in Noida. They are supposed to host a COE and do all these prototyping and pilots. Perhaps as you discuss more in partnership with Neeti, we'll be able to update more details on that front. That is point number one. And second thing, some of you raised about, QIC, how they brought out all the best practices and information at one place. In one of the presentations, member technology also shared about bharatdigicom.in. That's one portal which Honorable Minister of Communications launched very recently during India Mobile Congress. What it helps, I'll tell you. In the ecosystem, we have got the service providers, we have got equipment makers, system integrators, solution providers, as well as users, standardization bodies, and regulatory partners. If you're developing a product, let's say for health sector, health IoT, let me say. So you can look at in the portal, okay, in health IoT, who are the COEs developing a similar product? Who are the technology companies working on that product? Who are the service providers who may give me opportunity for doing the pilot? Which is the government department I should go and approach, where the funding can come, what's the kind of standardization activity happening in the particular device or the particular framework, and also the opportunity to become part of, we have created a team called the Lagan team, where all these people together, we go to vertical ministry and present, this particular opportunity. I can vouch for our service providers who have been part of such discussions. All this information is available at one place, bharatdigicom.in. So please, look at that, how it can help. We have got our coordinates as well there for your needs. I am also requesting our friends from other secretaries and as well as other ministries with regard to connectivity, with regard to use case applications, make use of the portal and, be part of the ecosystem, how we can work together. Collaboration is the only way to make really 5G work. Thank you.
Thank you very much. So Dr. Paul is now, I think, going to join us in 2 minutes. Before that, I would just like to answer the last question. This is not something where we'll end it with vote of thanks. We are recording all the points and ATR will be made and we will make you part of the group going forward. So that is a commitment from Niti Aayog. That is how we work, and we will be working in an action-oriented manner. Second, the important point is about data and also validation. Dr. Paul mentioned about validation. So validation is much beyond, COEs and pilots. Niti Aayog have validated 2 solutions on the ground, but that is an ad hoc manner. Now, under the leadership of Dr. Paul, Health Ministry, ICMR representative is also here. There are networks which are not being leveraged, so an institutional mechanism will be put in place as a takeaway from this conference, from this workshop for validating solutions. So that will be notified shortly after the system has been discussed with Ministry of Health, and that hopefully will help, validating solutions. On data, Madam, we will be reaching out to you because under chairmanship of Dr. Paul, we have developed a framework for medical imaging biobank, and how through public-private partnership these biobanks can be developed at scale. So I already messaged Rupal that we should reach out to you on that framework. So that is about provision of data. So these are the 3 things I wanted to answer. I would now request Dr. Paul to come and, sir, basically, yes. Yes, sir. So, sir, I just, first of all, one apprehension was raised that this may not end into anything, and what do we do as next step? So it has been mentioned that we will be coming out with a ATR, and we will be updating it, following it with relevant organizations like, about the TC which was mentioned, that we will be following up with MOCA and several other things. Second, sir, about 2 pertinent issues were raised. One for validation of solutions the startups wanted, and second for availability of data. So on availability of data, I mentioned about the MIDB framework which we are working on, And second, on validation, I said that you are already thinking on these lines. You also referred to it in the morning. So I think you will speak more on that now. We were not sure whether you'll be joining back. So, so data availability of data for test, they are getting data from outside of India, which is a problem that we are facing, sir.
For example?
Images, sir. हम वो कर रहे हैं ना medical imaging biobank वाला.
Okay, maybe before I speak very briefly, if there is, maybe I'll get 3 inputs from you. 3 बातें कोई main theme बताना चाहेंगे? मैम ने तो बता दिया, हम तो time devote करेंगे. 3 ideas, one from this row, anything? You can pose the same question as ma'am has summarized, but just to do justice to my presence here. All right, anything? No, उन्होंने जो कहा वो मैंने सुन लिया. So let me say the following, that this manthan that we underwent today in your presence will serve as opening a definite and a new pathways for us to take technologies to their legitimate use end to end, the other end in particular. And for that, we also urge you that look at multiple use cases for each theme of technology. I'm repeating that. Drone में क्या क्या नया है, वो भी कहाँ और किस ज्योग्राफी में ये खास इस्तेमाल, इसको भी सोचिए. ट्राइबल बेल्ट में हम कैसे सेवा कर सकते हैं, फॉर एग्जांपल. वहाँ पे स्कैटर हो जाती है, पॉपुलेशन छोटी होती है, डिस्टेंस के टाइम भी ज़्यादा होता है, पहुँचे भी. तो उस नज़र से थोड़ा सोचिए और वहाँ रूटीन सर्विसेज में भी इस्तेमाल होगा. निश सर्विसेज तो सभी जगह इस्तेमाल होगा. यहाँ डिज़ास्टर होता है, नवी मुंबई में भी हम ड्रोन से जा सकते हैं, लेकिन वो जो है वो रोज़ की सिचुएशन है. इसी तरह से 5G की या AI की जो मल्टीपल यूज़ केसेस को सोचना शुरू करिए. कुछ को मैंने पॉइंट आउट करा है प्राइमरी हेल्थ केयर की नज़र से. सो कंसल्टेशंस फ्रॉम हेल्थ एंड वेलनेस सेंटर और प्राइमरी केयर हब to higher levels with additional inputs in terms of diagnostics, precision of information, specimen transfer, and sensors, let's say, in a very big way. इसी तरह से जो बात हुई है कि primary care, high risk pregnancy issues, issues that are related to providing unmet technologies such as specs to children. कुछ आइडियाज़ हमने कहे हैं, लेकिन इसकी लिस्ट को लंबा करिए आप, और लंबा करिए और ग्रुप करके हमें दिखाइएगा. बिकॉज वन पार्ट ऑफ दिस वुड ऑल्सो बी हाउ वी प्रमोट दैट. आज हमने उसकी बात ज़्यादा नहीं करी कि पाइपलाइन को ही सीधा कर रहे हैं, लेकिन उनको प्रमोट करने के लिए अटल इनोवेशन मिशन में हम क्या कर सकते हैं, ICMR सिस्टम में क्या कर सकते हैं, बायरैक सिस्टम में हम क्या कर सकते हैं, और स्टार्टअप सिस्टम जो अलग ही एक एंटरप्राइज है उसमें हम क्या कर सकते हैं मिल के जुल के. So we'll work on this, and particularly again I want to emphasize that I found the most important valley of death that needs to be addressed, where technologies just die out and you get fed up, or they just lie there for long period of time and for frustrating months and years, is to be able to create a real life laboratories, shall we say, in facilities, in primary healthcare settings, in community settings, in home settings, where we will create a system with the help of our partner organizations. We'll work on that path. Thank you very much. Thank you. Thank you.
Thank you so much, sir. So as I conclude today's workshop, I would like to specially thank members from Niti Aayog, Shri Suman K. Berry, Dr. V.K. Paul, Ms. Anna Roy, and Shri Rajiv Bansal, Secretary Civil Aviation, Shri Sanjeev Agarwal, officials from the state, Health Secretaries Arunachal and Meghalaya, members, representatives of the industry, and members of the startup industry. Thank you all so very much. I would now like to request you to please proceed for high tea and networking. Thank you so much. Okay. Before we proceed for the high tea, I'll please request everyone to come near the dais for a group photo.